Good morning. Shall I start the presentation? Yes. Okay, there's no response, and I think it's 5 minutes past 10, so I'm going to start the presentation. I'll just start sharing my screen.
Ma'am? Good morning, ma'am.
Can you allow me to share my screen? The host has me to...
Ma'am, good morning, ma'am. Hi, Lakshmi, ma'am.
Share my screen.
Ma'am, can you hear me, ma'am?
Yeah. Enable screen sharing from my side. I'm not able to share my PPT.
Good morning, ma'am.
Good morning.
Am I audible? A very good morning, ma'am. Before we start off with the session, I would like to address the congregation.
Good morning. Can you please allow me to share my PPT? Host is disabled.
Ma'am, I would like to introduce you among the participants first before starting the session. So can you allow me? Actually, I had some technical issues, so sorry for that. Respected Chancellor Sir, Vice Chancellor Sir, Board of Trustee Members, Advisory Board, Dean Faculties of different departments, honorable speakers and participants, a very good morning to one and all present here. Myself, Sainusher Sharma, would like to welcome you all on the second day of virtual continuing nursing education organized by Faculty of Nursing, Assam Downtown University. It's an immense pleasure to grace all of your presence here today. Before we begin to the session, I would like to unfold today's program schedule. I would like to share my slides, so can you please allow me to share? I'm unable to share my slide because the host is not allowing, so I will just read out today's program schedule. First of all, in the first session, we will have on the topic supporting immune health and mental health during COVID-19, which will be done by Dr. Sai Lakshmi Gandhi, Professor and Head Nursing, Nimhans, Bangalore, Karnataka. And in the second session, there will be one more session on the topic managing ICU surge during COVID-19 crisis, rapid guidelines. And the resource person for this session will be Ms. Madhuri Gawas, Assistant Nursing Superintendent, Saifi Hospital, Mumbai, Maharashtra. And in the last session, session 3, swift direction of rural community response to COVID-19, and the resource person will be Dr. Bhuvaneshwari G, MSc Nursing PhD, Associate Professor, Community Health Nursing, Savita College of Nursing, Saimas, Tadalam, Chennai. And in the last session, we will have a valedictory session, and under that, we will have feedback from participants, a word of thanks, and then concluding remarks by Dr. Pratap Chandra Sarma, Chairperson, Faculty of Paramedical Sciences, Assam Downtown University, Dr. Biplab Kumar De, Dean, Faculty of Pharmaceutical Sciences, Assam Downtown University, Professor Ms. Nirmali Gogoi, Co-Chairperson and HOD, Faculty of Nursing, Assam Downtown University. Now it's time to start the session, and for this, I would like to take the opportunity to introduce today's first session speaker. Ma'am, Dr. Sai Lakshmi Gandhi, Professor and Head Department of Nursing, Nursing Consultant in Psychiatric Rehabilitation Services, Geriatric Psychiatry Services, and Adult Psychiatry Unit 5, Nimhans, Bangalore, Karnataka.
Yeah.
And ma'am's educational qualifications are, ma'am has accomplished her MSc and PhD degree in psychiatric nursing in the year 2006 from Nimhans, Bangalore, Karnataka. Ma'am has also achieved uncountable recognitions and awards in her professional life. Among them, I would like to highlight some of the major achievements, such as Best Outgoing Student in BSc Nursing 1984 from CMC College of Nursing, Bangalore. The President's Gold Medal in Nursing 1984. The Florence Nightingale Award for the Best Nursing Tutor in Karnataka State. Award given by Governor Karnataka State from the Florence Nightingale Nurses Welfare Association on 2009. And Dr. Radhakrishnan Gold Medal Award for Excellence in Individual Achievements and National Development by Global Economic Progress and Research Association in 2012. Florence Nightingale Award by President of India for Best Nurse Educator on 2014. Best Poster Award at the 3rd International Conference on Mental Health and Human Resilience held during June 2017 in London, UK. Mental Health Leader Award from the World Health and Wellness Congress from 2020. Dr. Sai Lakshmi Gandhi awarded for the Aparna Bhaduri Oration to 2020 by the College of Nursing, Mahdi, Manipal. And also MEM has guided numerous research studies for PG and PhD students. Not only this, MEM has also published 116 journal articles, 30 books, and 28 monographs. Again, MEM has organized 57 workshops, international conferences, and 2 national conferences. Dr. Sai Lakshmi is also a regular participant at many national and international conferences and workshops. Last but not least, MEM has also presented 21 scientific presentations in various international conferences and another 21 scientific papers in various national conferences. And MEM is also a membership of various national and international associations and committees, such as Chairperson of Anti-Ragging Committee at NIMHANS, Chairperson of Department Ethics Subcommittee, member of NABH Core Committee NIMHANS, member of PhD Committee NIMHANS, member of Library Committee NIMHANS, member of BOS at NIMHANS, member of Academic Council at NIMHANS, member of Sexual Harassment Committee, member of Suicide Core Group at NIMHANS, member of Committee to Assess the Best Group D official at NIMHANS, member of BOE NIMHANS for DPN, DN, and MSc Psychiatric Nursing, PhD Nursing, member of Roster Committee at NIMHANS, member of BOE at RGUHS for MSc Psychiatric Nursing, member of BOE at Dayanand Sagar University College of Nursing, Bangalore, member of BOH at Dayanand Sagar University College of Nursing Sciences, Bangalore, and member of BOS of MSc Psychiatric Nursing and DPN and qualifications and achievement. It is no surprise that she has been a proven leader throughout her career. Welcome you, ma'am. It's a great pleasure to have you here today. So without more ado, I would like to request Dr. Sai Lakshmi to start the session on the topic supporting immune health and mental health. Platform is yours.
Thank you. Thank you so much. Please enable me to share my PPT. It is disabled. You have disabled.
Ma'am, shall I share your slides?
I prefer to share it myself so that I can move it myself. Can you please enable me?
Sure, ma'am.
Okay, have you enabled me?
Yes, ma'am. Can you please check now?
Yeah, yes. Thank you. Okay, please tell me whether my slides are visible to you.
Yes, ma'am, it is visible.
Okay, thank you. So let me first thank Dr. Manishi, the Dean, and her team of organizers for inviting me to talk. And I think this topic is very important, supporting immune and mental health during COVID-19. As I go on, you will understand the reasons why. So let me take you all back to the International Council of Nurses 2020 theme, Nursing the World to Health, with a focus on the value of nurses to the people of the world. So the important thing, the outline of content will be on the mind-body connect, mental hygiene, immune hygiene, and a little bit about some helplines at NIMHANS. So before we start, I want to emphasize on the very first point which I had mentioned, which was the mind and body connection. So when the individual faces any stressor, the cortex immediately labels the event. And when the cortex labels the event, the message moves on to the hypothalamus. From the hypothalamus, it goes in two pathways. One is the cortico-releasing factor, which is released and it acts on the pituitary gland. And from the pituitary gland, again, you have adrenocorticotropic hormone, which acts on the adrenal cortex, or pituitary gland itself directly acts on the adrenal cortex. From the hypothalamus, there is another pathway also through the sympathetic nervous system, which sends a message to the adrenal medulla. So from the adrenal cortex, now again, you have two pathways here. One is it goes to the adrenal medulla. Other one is it releases corticosteroids, which acts on the higher brain regions. So the higher brain regions are those of memory, judgment, decision making, critical thinking, or it could be even past earlier experiences. For example, a nurse who is working in the casualty and suddenly she sees many people, maybe a mass accident or many people coming to the casualty. So her instinct reaction would be of panic or fear. But then earlier experiences, her brain would remind her that you can manage this. So that is the higher brain region. So there's another pathway also from the adrenal medulla, which releases catecholamines. Now, these catecholamines act on all the non-central nervous system tissue. So that would be the skeletal system, the muscular system, the cardiovascular system, and so on. So what exactly is happening is it is preparing the body to either, fight this stressor, whatever it is, by fighting, or it could even prepare the body to flight. That is, immediately leave the place and run away, or to freeze. So by freezing, the person goes into total panic state and they just freeze there. So what exactly happens is catecholamines act on your skeletal system, muscular system. So your body, your muscles contract, they get tensed, and your bones also get ready to either run or to fly, to escape from that place. So this is the pathophysiology of stress, what exactly happens. And that is why we say that, there is a connection between our mind and the body. What causes disturbance in the mind? Right now, from 2019 December, predominant driving force, I think, in everyone's mind would be more of fear, anxiety, panic, especially, fear related to the COVID-19 or fear related to the vaccine, especially maybe pregnant ladies, should I take the vaccine? What will happen to my baby? So there are a lot of disturbing thoughts which are occurring in the mind, or it could be concerns about infecting loved ones, especially healthcare workers, nurses, doctors who are working in the hospital when they return home. Will they be carrying the infection home? Or it could be, depression because of attached stigma. Of course, stigma now has come down a lot, but earlier there was a lot of stigma attached, especially to healthcare personnel. People would be scared to come close to us. Or loneliness because of the imposed social distancing. Because of the COVID appropriate behavior, we have to maintain social distance from people. And so because of that, a lot of loneliness. So anxiety because of existing comorbidities. Now we all know that the existence of diabetes, hypertension, all these comorbidities actually increases our risk for getting the COVID infection or for severe illness, maybe even going on to the ventilator. So naturally, anxiety increases for such people also. So these are a few of the situations which causes disturbance in the mind. So there is a science to handling anxiety, and that science exists in the mind. You all have heard of the limbic system. So the amygdala, you will see here, it is the seat of emotions. So what happens is when you get a threat, from the, maybe you see something. So from the visual cortex, the message goes immediately to the amygdala, and amygdala actually does not respond, but rather it reacts. By this, what I mean is reaction is in a very negative manner. That is, you immediately feel a lot of fear, a lot of panic, a lot of anxiety. You just want to run away from there, or maybe you want to take alcohol or smoke. So all the maladaptive things you want to do. Here you have on the other side, you have the prefrontal cortex. So the prefrontal cortex is actually the part where you can think, where you can do problem solving. And it is possible that the prefrontal cortex can train the amygdala to respond and not to react. So by responding, what we mean is that you do problem solving. So you face a situation, a crisis. So now instead of running away, or instead of behaving something differently, you try to solve problem. You try to talk to people. You try to see how to get this confronted, how to work out this. So that is why you need to train the amygdala to respond and not to react. And for this, the prefrontal cortex is very useful. Now, how does one optimize your mental health? So just like you have physical hygiene, and we all practice physical hygiene, we also need to practice mental hygiene. And how do we do that? So there are many ways how you try to handle your disturbing emotions, not only anxiety, it could be fear, panic, any disturbing emotions which this pandemic has invoked in all of us. So one would be by sharing. So I know that we are not able to meet, go to relatives' house or meet friends because of COVID, but still you can connect with others while maintaining your COVID appropriate behavior. So you can connect through video calls, through telephone calls, and of course in small gatherings, wearing mask, at the same time maintaining appropriate distance. So you can still have that opportunity to connect with people. Don't get totally panicky and stay away from people. We can diffuse anxiety by naming it. So sometimes what happens, you feel very anxious, and when you name it, why are you feeling anxious? So when you're able to put a name to it and then talk about that to others, you are able to reduce your anxiety to a great extent. The next way is to decrease anxious thoughts and to manage your distress. So you need to identify what is the trigger. What is it that is making you every time, very anxious or afraid or panicky? So identify that trigger. The minute you identify the trigger, you need to work at facing the trigger. One method is you can try grounding technique. So it could be that it is a nurse who is working in the COVID ICU, and you are suddenly, you have a lot of anxiety because your patient, you can see deteriorating in front of you. So you need to stay grounded. So even in those times of distress, you need to think of some normal thoughts. Maybe think about your own family or your friends, which will keep you grounded, and so that you don't become totally panicky and unstable. You need to take breaks from social media. Now we see that the WhatsApp is the biggest university in the world. You can see what all messages are shared in the WhatsApp. So try to avoid social media like WhatsApp or for Facebook or blogs, because you find that a lot of things which are unnecessary and not actually correct or true are being shared, and that makes you more panicky. So it's a good idea to take breaks from social media, and always remember to have a sense of humor, because it is humor which is going to actually de-stress you. So share jokes, laugh, and these are good ways of handling anxiety. There are other ways to practice mental hygiene. One is talking about it. So you could talk about it to someone whom you trust a lot, whom you have good rapport with. So it could be your friends or your family. So when you talk, you are able to ventilate. And when you ventilate, you'll find a lot of relief. And sometimes maybe the other person also gives you some solutions to your whatever stressor or crisis that you are going through. There are two other important techniques. One is called the mind box. So mind box is, suppose you are in a situation which is very stressful and you feel a lot of fear and some thoughts also keep coming in your mind. So what you have to tell is, you have to tell yourself that I am now going to put this thought into my mind box, and maybe evening later at 5 p.m. I will have time to confront it, not now. So you are actually trying to make a control on yourself. You yourself are controlling your emotions. And that is what I said about using the prefrontal cortex, where we are thinking, to control our amygdala. So you make a control and say that I'm putting it into this mind box and I'm not going to think about it now. The next one is something called as comfort bag. So a comfort bag, it can be a virtual bag or it can be a real bag, where you put into it, something which makes you very happy. Maybe you have virtual pictures, images of happy times with your children, with your pets, with your family, with your friends, or it could be some scent which you like a lot, or flower which you like a lot. So anything which makes you happy and comfortable, you put it into that virtual box or a real box. Whenever you feel very low, you go to that box, you open it up, and then you experience all those happy moments. So what happens when you do this? You are bringing a control on your mind. You're stabilizing yourself, and your mind starts understanding that you're not going to give in to anxiety or fear. So these are two useful techniques which anyone can practice. Next is, stay fixed to routine. That's very important. So even suppose, you have lost someone and now, of course, this COVID has created scenarios where multiple members of a family have been lost. So what happens? You need to again try to stay grounded. So stick to routine. So take one day at a time, do routine things. When you do routine things, whatever you do in a day, when you start doing that, again, you are trying to stabilize your mind and your emotions. So less screen time, humor, reaching out to loved ones, practicing gratitude is very important. So you need to, thank God every day for every little small thing which has happened in that day. It could be maybe even the rose flower which bloomed in your garden. So that, thanking God for that. So even for small things, when you thank, then you feel more compassionate towards others who don't have these things. And these are all good for your mental hygiene. Engaging in safe, pleasurable activities. So it could be, some hobbies which you like a lot, maybe listening to music or going for a jog, going for a walk in the park. So something which is safe and at the same time which is pleasurable. So this, what happens when you engage in such activities, a lot of your feel good hormones, they are released. Serotonin is released in your body and you feel very happy and very good. You feel you can face anything. So it's important to engage in such activities which make you feel happy every day, at least on a routine for maybe half an hour, 1 hour. Be positive. You need to block and divert negative thoughts. I know that, these are very uncertain times, but actually the past 1 year has taught us a lot. And now we are a little bit more familiar with the COVID SARS virus. And now we are able to actually take care of ourselves. Last year, if you compare with last year, we have reached, a far more safer zone. But of course, there are still a lot of anxieties, panic, fear. And as nurses, we have to address public fears. Especially now, a lot of talk about giving vaccine for pregnant women. So we have to allay their fears, and children, the third wave people are telling is going to target children. So it's important that you try to teach parents, mothers, how to block negative thoughts about all these fears. This is a thought cycle. So when you engage in positive self-talk, so you can always train your brain. It is not that you have to be slave to your brain, but rather your brain should be your slave. So engage in positive self-talk. It could be that I am doing very well and I am able to do this, and I have accomplished this much, or I look good. So a lot of positive self-talk. So when this happens, your brain realizes and feels good that you have achieved high, and you are also able to perceive yourself positively. You're able to perceive others positively, and you have a lot of rewarding relationships. There is, because of this rewarding relationships with others, you are able to appreciate others So others feel good about you, and this leads to a lot of improved self-confidence. So you can see this is a thought cycle, and it is good to engage in this, because by doing this, you are going to have good mental hygiene. So these are two pictures. You can see on one side, negative thinking, you feel very bad, you don't exercise, you feel the core thought in your mind all the time is, this is for people who are maybe obese. I feel fat and I think I am. So they feel bad. And because of that, they want to lie down in bed all the time. They don't exercise, and then they eat too much. So it is a vicious cycle which goes on and on. So these are the effects of negative thinking. On the other side, you can see positive thinking. You feel that I am beautiful and I think I am. So when you think thoughts, good thoughts like that, you feel good, and then you are immediately motivated to engage in regular exercise, eat healthy food. So this is again a cycle. So you can see both sides of the coin, what happens. It's also important for all working people to maintain a very good work-life balance. You should be able to give quality time at home with your family, with your children, with your pets. The minute you go home, you should be able to switch off whatever has happened in the workplace. If it is working in the hospital, forget about whatever happened in the hospital. The minute you enter home, you are there for your family and your pets only. And suppose you are isolated or quarantined, you can always still, call through video calls to your loved ones. And of course, there's a lot of work, and especially for women, we are expected to do a lot of work at home. We are expected to cook, to take care of the children, their education. At the same time, work in the hospital or in the college, wherever you are working. So you need to, delegate work which is there at home to other members in the family, so that you also stay healthy and you can take care of them. So, we had many lockdowns, and even now, right now, some states are still going through certain, sort of graded lockdowns. So it is good to take help from children, because children are at home, and it's good, life skills for them to learn how to clean vegetables, cut vegetables, wash vessels. It's good for them to learn. So take help from every member in the family, so that you feel, you have time for everything. You can also take support from family, neighbors, friends, colleagues. For this, you have to reciprocate. So when they need help, you should also help them. And it's very important. The social support networking is very good to make you feel that you are not alone, that there are people to help you when you are in a crisis. So similarly, like I said, at home, even in the workplace, you should delegate work. If you are a manager, or if you are, a teacher, you should learn to delegate work depending on other people's capabilities. So when you delegate work, you are also training them to manage when you are not there. And that is very important. The world should go on even if you are not there. That's important. Next is, compartmentalizing. Suppose you have some important work to do. So make sure that you complete it. So time management, prioritizing your work, all this will help you to maintain your work-life balance. So now I will move on to supporting immunity hygiene. Actually, mental hygiene, immunity hygiene, physical hygiene, all these, emotional hygiene, all these are interrelated, interconnected. So many things might overlap. But here is a picture which will tell you what happens when our immunity is low. So for any human being, you might have some element of pre-existing vulnerability. And this pre-existing vulnerability could be because of, genetics, what you have inherited, or it could be because of your personality, or it could be because, you have generally, you don't eat well, your lifestyle is not healthy, it's not adaptive. And because of this, you are, your immunity is low. So because of that, when you are exposed to stress, you tend to have some behavior changes because of all this pre-existing vulnerability. And there is also a lot of wear and tear on the body. So what happens is, a combination of wear and tear on the body and behavior changes leads to something called as symptoms. So these symptoms could be headache, it could be backache, it could be body pain, it could be frequently getting common cold, cough. So any symptom. And because of this frequency of symptoms, you feel very weak. You may develop a full-blown illness, or you could start developing something called as illness behavior. So illness behavior is, you stay back from work, you take medical leave frequently, or if you are at home, you keep lying down on the bed. Actually, you are well, but still you feel ill. And this is all because of your low immunity. And that's why it's very important that we build up our immunity. Of course, immunity is not a way to treat illness, but it is a way of preventing illness. So these are some important methods. And I think this COVID-19 pandemic has taught us a very important lesson about how to maintain healthy lifestyle, which many of us have forgotten and we are not engaging in. And it's a good time to teach children also about healthy lifestyle. So there are 5 important aspects of immunity hygiene, and these are nutritious food, hydration, sleep hygiene, active life, and relaxation techniques. Let's see this one by one. Much of it you might know, but we can review these in case you know it. So immunity hygiene. It's important that we take nutritious food in this time of a very stressful time. Take a lot of leafy vegetables, colorful vegetables, fruits, and a balanced diet where, on a plate you have less of your roti, chapati, or rice, but more of vegetables, dal, fruit. So you should have a balance in your diet. So when that happens, your immunity is going to be high. So you see, when you eat carbohydrates, you have more serotonin. So serotonin is a feel-good hormone. It's a good hormone. And when you eat more of fiber foods, again, because when you are in stress all the time, you also have constipation, abdominal cramps, because you need to observe yourself. When you are stressed, you automatically tense your abdomen. So that leads to a lot of cramps. So eating fiber fruits actually helps in releasing all this. Now, vegetables also. Colorful vegetables contain L-tryptophan, which is very important, which increases serotonin and also helps you to sleep well at night. Whole grains, this also increases the serotonin level in the body. So green, yellow, orange, all these very brightly colored vegetables and fruits, they are very good for you because they boost your immunity system. You need to avoid stimulants because these are all actually cause of stress. When taken in very, very small amount, moderation, it is fine. But when you exceed it, it's going to reduce your immunity. So these are, coffee, alcohol, smoking, sugar, salt, fat. So all this you have to take less and not more. Some foods have some stress reduction properties, like raw food is good for you. Raw foods are very rich in flavonoids, and flavonoids help you to face stress. And all our age-old traditional food, which in India we are, our grandparents used to follow, this cloves, cinnamon, ginger, turmeric, garlic, amla, all this is very good for you, but in moderation. Again, people blindly last year thought that, they should take large amounts, and they used to take a large amount, but then it had a very bad effect on the gastrointestinal system. So take it, but take it in moderation. It's good to build your immunity. So healthy eating. Now, many of us working people, we always skip breakfast because we are very busy. We get up in the morning, we have a cup of coffee on empty stomach, which is not good again because it leads to gastric irritation. And then we just rush to the workplace. So we may have our food maybe around 12 o'clock. We have a combination of breakfast and lunch as brunch, but that's not good for your body because it has been fasting the entire night. So to maintain stable blood sugar levels and to have effective functioning during the entire daytime, you should have a good, healthy, heavy, nutritious breakfast. That's very, very important. Dinner should be very light and early, at least by 7 p.m. And snack on healthy food. So always store your fridge with nutritious snacks. Don't have any, this oily snacks, chips, and all those sort of things at home. The best thing is if you don't keep it at home, you cannot eat it. So keep only nutritious things which you can eat, like almonds, nuts, dried fruits. So these are all good, healthy snacks. Stop emotional eating. So some people, when they are very low, when they are depressed or when they are angry, they immediately reach out to something to eat. And that actually makes them obese. So it's important that you try to stop emotional eating. We need to make sure that we keep ourselves hydrated. Many of us forget to drink water when we are at the workplace, but it's important, because if you are dehydrated, if you don't drink well, you tend to get irritable, you tend to feel angry, you have loss of temper frequently, even you may not be able to focus properly. Because of all this, you might have some clashes with your co-workers, so that could make your workplace even more difficult. So keep drinking sufficient water, and it's a good idea to drink green tea at least 2-3 times a day. So about sleep hygiene, I'm not going to talk about, the routine sleep hygiene, which we all have learned as nurses, but a few tips, important. Sleep is very important. I'm sure those of you who have sleep problems will agree with me, because if you don't sleep well, you just cannot function properly the next day. So it is important that you get a good sleep. For this, have a light dinner early by 7 p.m. and after that, don't eat anything. Avoid watching any social media after 8 p.m. Avoid mobile use, because there's all sorts of panicky things out there. People just keep spreading messages, and that's only going to make you more anxious. So don't use your mobile after 8 p.m. And it's important that, many times what happens when you sleep, some thoughts keep coming in your mind. I have to pay my daughter's school fees tomorrow. I have to book the gas. So these sort of thoughts sometimes suddenly come into your mind at 1 a.m., 2 a.m. So the best thing to do is you write down a to-do list, either in your mobile, in your notes, you write it down. So when you have written it down, your mind knows that you have written it down, and it does not keep trying to remind you at odd times in the night. So you have a good undisturbed sleep. Important that you tell a gratitude prayer before bedtime when you get up. You should be thankful, because we are all still here despite this COVID-19. Many people have lost their lives, have lost their families, have lost their jobs, but we are still here. So it's important to think of all that and to pray a thank you to God. And this also helps you to feel compassionate to those who have lost so much. So that's good for your sleep. And maintain an active life. So try to engage in any sort of exercise which makes you feel good. Do something which makes you feel good. Don't do something which others force you to do, because you need to enjoy what you do. It could be taking a brisk walk in the park, or going for jogging, or it could be swimming, or it could be aerobic dance. You can dance inside, or you could put on music, anything which makes you feel good. But do be active at least 1 hour a day. And if your job is something where you have to sit for a long time, every half an hour, get up, take a walk, come back and sit. This is important. Continuous sitting or standing for a long time is not good. And exercise with a friend or a companion, because even on days when you feel low, your friend will definitely call you and motivate you to join him or her. So there are some relaxation techniques which I wanted to speak to you about, because despite all this, there are moments when you feel that, it's all going out of control. The anxiety is too much, the panic is too much. So these simple techniques will help you to cope with your fear, anger, or whatever disturbing emotions you have. One is mindful breathing. So be aware of your breathing in and out. So keep breathing in and out. And whenever your thoughts keep going here and there, bring them back to your breathing. So just close your eyes and do it for 1 minute or 3 minutes or 5 minutes till you feel calmer. And this is a very good technique, because you can do it anywhere. You can do it in your workplace, in the hospital, in the ward, in your office, or even in the bus when you are traveling. So it's a simple technique. The next one is square breathing. So square breathing is another simple technique. What you do here is you breathe, take a deep breath to a count of 1, 2, 3, 4, and then you hold your breath for a count of 1, 2, 3, 4, and then you breathe out slowly to a count of 1, 2, 3, 4. So when you do this, in a very systematic manner for 3 or 4 times, you will feel very calm. Whatever disturbing thoughts you have, will stabilize and it will go away. So these are simple things which you can do wherever you are. You can teach your patients, you can teach community, you can teach pregnant women, children also. You can, through games, you can teach them to do this so that they also learn at a very young age how to cope with stress. So yoga is very good. It's a very, very good technique. It brings in flexibility in your body. It helps you to relax. It makes you feel good the entire day. There's a lot of release of all the good hormones when you do yoga. So it's good to even teach small children. Now every school teaches yoga. So good to encourage them to do this. And music, some people enjoy listening to music. It has a calming effect on them. So if that is so, then you should do that. Meditation. So there are different types of meditation. Meditation also helps you to, think, to be very calm, to keep the external environment and all the other disturbing thoughts out of your mind for that period of time, maybe 10 minutes, 15 minutes. So your mind stabilizes and you feel better. You feel actually more energetic to carry on with the rest of your work. So recollecting fun times, happy memories. If you recollect, I spoke to you about the comfort bag. It's a good idea to have such happy memories in that virtual bag. Whenever you feel low, you just have to go reach out to that and then you feel much better. So it's a good idea to connect with your soul through prayer, through meditation. Spirituality also is good, especially in these uncertain times. It is very helpful. So these are different ways for well-being. Talking about your problems. Never keep quiet. Never keep things inside you. Because the more you keep it inside, it's like a pressure cooker. One day it will burst. So it's a good idea to talk about whatever is troubling you with others. Do deep breathing. Do muscle relaxation. Set small goals. When you set very large goals and you can't achieve it, you feel very overwhelmed and you feel depressed. So set small goals and make sure you sleep well. These are some small tips for midwives, especially because now I think the whole world is looking more at, perinatal population and children. Vaccinating the perinatal population and taking care of children, building up their immunity so that they don't succumb to the third wave. So there is a lot of anxiety, fear in pregnant women about their baby, about themselves, about their spouse, about going in for delivery to the hospital where maybe there are other COVID positive patients. So all these anxieties are there. So as nurses, we have to talk to them and help them understand and reduce their anxiety and fear. So nurse leaders also have a lot of tension and anxiety because they carry a huge responsibility. They are responsible for the staff's welfare, for the patient's welfare, for all the workers' welfare. So they have a huge responsibility. So again, you all have to take care of your health, the stress levels, sleep well, because these are all things which are going to be there day in and day out. So keep in touch with your staff either through WhatsApp, through video calls. If you can't reach out to them, inquire about their family well-being, because these little things are going to make them feel good and it will increase their loyalty and their motivation to work. And arrange for staff who have worked in COVID wards earlier to share their positive experiences. Motivation enhancement videos can be shared in your WhatsApp groups too. Now, nursing students also, it's been a very bad time the past 1.5 years. So many have their own fears. They are young, BSc nursing, GNM nursing students. Many colleges now have asked them to work in the COVID wards. It's actually a good experience because you may never again experience a pandemic like this. It's a good opportunity to learn. But there are a lot of fears in the mind about, will I be asked to work in the ward, or anxiety about exam. And because many classes are online and maybe they didn't understand. So how do I understand and how do I get good marks? Fear about, family if they are staying in hostel, feeling lonely. And because now everything is online, increase social media use. They are always on WhatsApp, on FB, blog. So all that can be very addicting. And that can have a very bad effect on the mental health. So it's important to have control over the social media use, only for maybe 10 minutes, half an hour a day. So when you control yourself, you are able to avoid the dangers of social media use. Now, when do we seek help from a psychiatrist or a psychologist? So when we have to go for help is when you feel depressed for most of the day, when you get excess anger, sometimes suddenly without reason you feel irritable, you're not able to control your anger, or you have a lot of morbid fear, or you find that you are using, you are on the screen a lot, you are always using social media, you're not able to control yourself, or you have continuous insomnia, or there are panic episodes, or you find that you have now started engaging in odd or unusual behavior, or maybe you see your friend engaging in some odd, some different sort of behavior, and now it is affecting your functioning also. You're not able to function well in the workplace or at home. So that is the time that when you need to seek help from a psychologist or a psychiatrist. Small amounts of fear, anxiety, it is normal, and actually it protects you, because when you have a little bit of fear and anxiety, you're going to make sure that you protect yourself, protect others during this pandemic. But when it becomes abnormally huge, that is when you need to seek out for help. Especially when you are sad, angry, disturbed, that's the time to seek help. So I'm concluding by telling that, you have to keep 4 important points in your mind always. And this mind is an acronym which I have made. So M stands for make contact through video chat with family, friends, stay anchored, stay grounded. By anchored, I think you will all, if you think of a ship when it is just brought to the land, and then after some time they don't anchor it. You know how they anchor it? By tying it to a huge stone so that it stays, it doesn't move away to the ocean. So that is what we mean by anchored. If that stone is not there, that ship is going to move out into the ocean. So how do you anchor yourself? By thinking about someone whom you love a lot. It could be your child, your spouse, your sister, your sibling, your family, your friends. So when difficult times, when you think about that, that is going to keep you anchored. I is for information. So always access only authentic information from authentic websites like the ministry website, WHO website. N is say no to alcohol, smoking, substances, excess screen time. So any sort of substance use. And D is de-stress through yoga, through deep breathing, exercise, music. Most important, all this is going to go away in a while. So with this, I would like to acknowledge all the COVID-19 warriors and Professor Manashi and her team. If there is time, can I show a video for 1 minute, a yoga video? Is there
Yes,
time
ma'am.
to show?
Yes, ma'am. Yeah, ma'am. Time is there. You can show. You can go ahead. No issues.
Okay.
I kindly request all the participants, please mute your mic.
Okay. Just a minute.
I request the participants to please mute your mic.
Now let us do some pranayama in sitting position.
Ma'am, video has started or what, ma'am?
Yes, could you all see that?
No, just now, ma'am. It is
Pardon
visible
me?
to us. It is visible to us just now, ma'am.
Oh, is it? Okay, then just 1 minute. Okay, is it there now? Can you see it?
Yes, ma'am. Yes.
Okay, okay.
Now, I'm going to teach you some yogic practices to reduce stress and enhance lung functions. First practice, hands in and out breathing, hands parallel to the ground. Take a deep breath in, open your arms, breathe out and come back. Synchronize your body with the breath. Do this for 10 counts. Next practice, hand stretch breathing. Take the fingers on your chest. Breathe out. Do this at 90 degrees. Then do this at 135 degrees. And then do the same practice at 180 degrees. Do this practice each for 5 counts. Then come to sitting position. Now let us do some pranayama in sitting position. Attention mudra. Full exhalation. Do this practice for 2 minutes. And then do hammering. Focus your attention between the eyebrows, touch your tongue to the upper palate, and produce humming sound. Do this for 3 minutes.
Okay, so can you see my PowerPoint slide?
Yes, ma'am. It is visible.
It is visible. Okay. So the detailed yoga video link is given here, and I've also given some video links for midwives, how to address mental health for perinatal population and for nurses too. And these are some NIMANS helpline numbers for psychological support for perinatal mental health. And we also have a psych care where we have a multidisciplinary team. So I am also on that helpline, and any sort of questions which you all want, you all can always address there. This is about a training of trainers program which we had organized last year with the financial support from WHO India and Ministry of Health and Family Welfare. So we have trained about 400 to 500 nurses, psychiatric nurses, for self-care of nurses during this COVID-19 pandemic, which will be useful for the future also in any stressful situation at the workplace also. And from this, 200 psychiatric nursing master trainers have trained 2,000 nurses. And now we are also going to handhold CIP Ranchi to continue this training for the Northeast side. So you might get invitations from there. Please do join. It's a 3-day session every day afternoon. So that's good for you to learn how to take care of yourself. I would like to conclude telling that health involves body, mind, spirit. So we have to pay attention to all 3 of these components. Thank you. Yeah, I have completed. Thank you.
Thank you, ma'am, for taking the time to speak to us today on a very important and vital topic. We have gained a lot of knowledge. I hope all the participants also have gained enormous knowledge about the topic. And ma'am has explained very well about the stress and what causes disturbance of our mind, and also how the science is handling our anxiety and how to practice our mental health hygiene, and with appropriate examples, and about work-life balance also ma'am has spoken very well. And about the immunity hygiene also ma'am has spoken, under that ma'am has spoken about the diet also, how to increase our immune, and then about sleep, and then about various relaxation techniques. So now I would like to open the session for discussion. So participants, anyone have any queries, you can drop in the chat box if you have any doubt.
Sainu, can I take 1 minute time?
Yes, ma'am. Sure, ma'am.
Hello, ma'am. This is Manushi.
Yeah.
So thank you so much, ma'am, for your time. It was an excellent deliberation. We are really indeed very fortunate to get the opportunity to hear from you, ma'am. Hope all our participants have surely gained from your session. You know, ma'am, as a nurse, we know this all bits, whatever you have explained, but we may not be able to maintain it with our activities of daily living. So this type of sessions will really boost up and will it will be helpful for us, like how small things like immunity, then the stress management techniques, you know, these are really helpful, and especially in this particular pandemic situations where everything, the world has actually been stopped, the normal living activities has really been stopped at a particular point of time. So hopefully, ma'am, thank you so much, and hopefully this particular session has really motivated the young nurses as well, and hope they will able to implement all this in their day-to-day practice. So thank you once again, ma'am, for your time. So we will in future also will like to hear from you, ma'am. Thank you so much.
Thank you. Thank you. It was a pleasure. Thank you.
So anyone from the participants who wants to who wants to clear any doubt, please drop in the chat box. I cannot find any queries in the chat box. I hope everyone has understood clearly and thoroughly about the topic. So now, once again, thank you, ma'am. Now I would like to move on to the second session. So now we are coming to the second session. Before moving on to the second session, I would like to introduce our today's second speaker, Ms. Madhuri Gawas. Currently, ma'am is working as an assistant nursing superintendent in Saifi Hospital, Mumbai, Maharashtra. And ma'am's professional qualifications are Masters in Pediatric Nursing Specialty, Postgraduate Diploma in Hospital and Healthcare Management from Lean Six Sigma Greenbelt. And also, ma'am is a life member of Trained Nurses Association of India, life member of Critical Care Nurses Society, life member of Infusion Nurses Society. So by seeing her deep knowledge and expertise in different areas of nursing, ma'am has proven that she has been helping in managing and motivating many throughout her career. Welcome you, ma'am. It's a great pleasure to have you here today. So without more ado, I would like to request Ms. Madhuri Gawas to take over the session on the topic Managing ICU Surge During COVID-19 Crisis Rapid Clinic. Over to you, ma'am.
Thank you so much, and very good morning to all of you. Am I audible? Am I audible? Can anybody tell me, am I audible?
Ma'am, are you there? Madhuri, ma'am?
Recording in progress.
Good morning, all of you. Am I audible?
Ma'am? Madhuri, ma'am?
Hello? Can you hear me? Hello?
Some technical some problem. Hello. Hello. Am I audible?
Yes, yes, you are
Yes,
audible.
ma'am.
You are audible.
Yes,
I
ma'am.
think
You're
there
audible.
is some technical problem I'm facing. Can you please share my video? Hello, can you please
Ma'am,
share
your
my
slides, ma'am?
presentation?
Yes, ma'am. Sure, ma'am. I will share.
Good afternoon, ma'am.
Ma'am, please give me some time. I'm trying
Yes,
to share your
sure.
slides.
Sure.
Host, please make me allowed to share the screen. I'm still disabled to share my screen, so please allow me.
This meeting is being recorded.
Vidya, are you there? Miss Vidya?
Hello.
Ma'am?
Yes. Can you just share my PPT, please?
Yes, ma'am, we are trying. I'm unable to share my screen because the host is not allowing me. So we are trying, ma'am.
Okay, because I'm not able to share here. Same message I'm getting that host is not allowing to share.
Ma'am, I have already made you as co-host from my side. So can you
But I'm still
try once again?
there is some issue that I'm not able to share
Okay.
this PPT.
transparent. Is it possible to share my PPT, please?
Sino, are you there?
Yes, ma'am. Yes, ma'am.
Please start the session.
Yes, ma'am.
PPT सर नहीं गया है.
Is the slide is visible to everyone?
Yes,
Yes,
it's
ma'am.
Thank you so much. And very good morning to all of you. Am I audible?
Your voice is not that clear. Kindly see to it.
Okay.
Okay. Can you all hear me?
Not yet.
Just hold on, just hold on. Hello, can you all hear me now?
Ma'am, is it okay, ma'am? The slide, the first slide.
Yes, this is, yeah, first slide, right.
But her voice is not that clear.
Okay. I think I cannot do anything much about it. Shall I start?
Ma'am, Madhuri, ma'am.
Yes. So I'm starting my session.
Madhuri, ma'am.
Yes, I'm starting my session. Can I start my session?
Yes, hello, ma'am, you can start, but your voice, I think there is some problem. We are not able to hear you. We are getting very far voice.
I don't think I'm very close to this.
Maybe you just can connect from your headphone once.
Just let me see.
Ma'am, we cannot hear your voice properly.
Voice is not clear. Okay, I think I should start to now. Maybe some technical problem. Y'all can hear me? Or it is still giving a trouble?
Ma'am, we are unable to hear your voice.
You are able to hear me? Okay, so I'm starting my session. I'll be talking about the managing ICU surge in COVID-19 crisis, the rapid guideline. As like everybody knows and talked about this topic, COVID-19, every now and then we are hearing about so many information. Hello.
Hello, am I audible? Am I audible?
Yes, ma'am.
Now you are absolutely audible.
Okay. Just give me some time. Put that off. Put that off. Speak. Give me charger. No, I have logged on my mobile only. From mobile. Yeah. So very good. Good morning, and sorry for this technical hiccups. I'm starting my session now. I'll be talking about how to manage the patient, COVID-19 patient in ICU. Now, as just earlier, Ma'am Sai Lakshmi, she talked about the mental health and how to improve on. But I'll be talking about what actual scenario happens in ICU, how to deal with acute state when patient with COVID positive, like COVID-19 positive, comes to ICU. Now, before starting, the goals of this sessions are like we need to first know what is COVID-19. Then little bit about the history, the clinical manifestation presented by the COVID-19 patient, then about pathophysiology, diagnostic test required to diagnose this disease, and the overall management of COVID-19 patient. Now, as everybody knows, and more of we talked about, every day we hear about this COVID-19, this coronavirus disease, which is defined as an illness caused by novel coronavirus, and it is caused because of the severe acute respiratory syndrome coronavirus 2, which was first identified in an outbreak of respiratory illness cases in one city, Hubei province in China. This coronavirus are a family of viruses that gets their name corona from many crown-like spikes on the surface of the virus. It was initially reported to WHO on December 2019. And on January 30, 2020, the WHO declared the COVID-19 outbreak as a global health emergency. Now, coming to the clinical manifestations, as everybody aware about. Just go to the next screen, please. Next slide. Next slide. Okay. Now, clinical manifestation, the most commonly we see patient exhibiting fever, dry cough, fatigue, which are very commonly seen sign symptoms in any flu. Otherwise, there are less common symptoms like loss of taste or smell, nasal congestion, conjunctivitis, sore throat. Next slide. Next slide, please. Then there is headache, muscle joint pain, different type of skin rashes, nausea, vomiting, diarrhea, chills, dizziness can be seen in this patient. In severe COVID-19 disease, there is shortness of breath, loss of appetite, then confusion, persistent pain and pressure in the chest, and high temperature has been seen. Other common, less common symptoms like you may find patient irritable, confused. Then there may be a level of consciousness can be altered. Patient will be anxious, depression will be there, and a sleep disorder can be seen in this patients. More severe and rare neurological complications such as stroke, brain inflammation, delirium, and nerve damage also can be seen in this type of patient. So there is a wide range of symptoms, signs, symptoms we could see in this COVID-19 patient. Next slide. Now coming to the pathophysiology of this patient. Next slide, please. Yes. The pathophysiology of COVID patient is very complex. Okay, it's a disease which compromises lung, heart, brain, liver, kidney, and the overall coagulation system. And the effect of this is seen based on the disease of the certain systems. Like there will be myocarditis, there will be cardiomyopathy, ventricular arrhythmias. Patient can have also acute coronary syndrome and even can go into shock. So it is at that extent that patient can, exhibit the clinical picture. Now, when we talk about the pathophysiology, the virus for that coronavirus is entered into the host cells, and there is an attachment of the virus and the host cells during this aerosol transmission, and this virus binds to the angiotensin converting enzyme 2, which is which is the mediator to transmit this this virus into the cell. Now, because of this, there is a viral spike protein release, and there is a penetration. Viral host and cell membrane fusion happens, and it creates the mediator like endocytosis, and the toxins. The cytotoxins are released because of this penetration, maturation, which happens between the host cell and the virus. Now, this proteins biosynthesis in the cytoplasm and release of new viral particles are seen in the tissues, and this transportation again newly form the viral particles, and there is a mutation and release of new viral substances. And again, this virus is ready to release to infect this, other for the community transmission. Now, when this attachment, penetration, maturation, and transmission happens. Next slide, please. Next slide, please. The binding of this inhaled SARS coronavirus to ciliated secretory cells in the nasal epithelium via ACE2, that is angiotensin converting enzyme 2, it replicates, and there is a it attacks on the immune system of the cells, the body. There is an involvement of the conducting airway and upper respiratory tract, and which migrate into the lower respiratory tract. And this invasion of virus and the infection created because of the damage of the pulmonary alveolar epithelial cells, there are lots of toxins been released at that moment. Okay, toxins are released at that moment. Battery is down. Now, this toxins, battery is down. Okay. The toxins are released in this, in this all phenomena. Now, what happens when the viral replication and the release of viral particles that results in the damaging the host cells, and this continuation of viral replication happens adjacent to the other healthy alveolar epithelial cells, and there is a loss of type 1, type 2 pneumocytes, and that creates the diffuse alveolar damage with acute respiratory distress syndrome. So that is a very critical stage where already the lungs cellular damage or injury has been happened. plus there is a cytokine storm. Cytokine storm means because of this reaction of the viral replication and the attack, there are certain toxins been released like IL-1, IL-6, IL-8, IL-10. Okay, these are the interleukin toxins which are released, and because of that there is a this attracts the neutrophils and damages the cell. Now, because of this, there is a sequestration of inflammatory cells in the lung tissues with CD8 mediated cytotoxicity, as well as there is a lung injury. So all overall, this phenomena basically attack on the immune immune system. The coagulation coagulopathy has been formed, and that's whole affect all other organs. So you can see the involvement of all the organs in this, like including heart, renal, brain, liver. So all these major organs have been involved at the end, and the ARDS is a major contributor to for the critical care of this patient. Next slide, please. Now coming to what are the diagnostic tests we require to perform to rule out the COVID positive patient. First, the most important and confirmatory test is RT-PCR. Okay, that is reverse transcriptase polymerase chain reaction test, where the nasopharyngeal and oropharyngeal swabs been taken, and even the sputum and bronchoalveolar lavage secretions also been used to test this for the confirmation of COVID-19 positive patient. Then another test is rapid detection of antigen test. Now this antigen test is usually was used as a emergency resort where the result was out within 30 minutes. But you cannot just rely on this antigen test. And other qualitative immunoglobulin tests like antibody IgM IgG test, which is also done as a emergency, in case of emergency where we require to know the status. But the most confirmatory test is RT-PCR. Next. Now, another test, diagnostic test, to know the inflammatory response, there are we require to test on C-reactive protein, which is again tells us about the inflammatory response. And the normal CRP, if you see, it is less than 8 mg per dl. But in COVID patients, suppose if it is more than 10 mg per dl, we need to worry about. Like next, procalcitonin, again, it is another inflammatory response, mediator, where we can see the prolactin is more than 0.15 nanogram per ml is considered to be high. Then ferritin test, which is usually normal, is less than 500 microgram per liter. But if it is more than that, then we need to worry about. Then the D-dimer test. D-dimer test, again, it gives idea about the coagulopathy, where D-dimer is more than normal is considered is less than 500 nanogram per ml. But if it is more than 1000 nanogram per ml, we need to worry about. Then other certain tests like IL-4, IL-6, IL-10, and tissue necrosis factor alpha and other indicators. We need to be check on that, because these are all inflammatory, gives us an inflammatory response. It tells us how much, what extent the injury is, the inflammation is. Next slide, please. Next slide, please. Sorry, just okay. Now, next test, check about bacterial or a fungal infection whether patient is exhibiting with. Now, in this case, the bacteria or fungal cultures we need to send, either it is direct swab, or we can collect the sputum, tracheal aspirate, or bronchoalveolar lavage fluid. Then we can just take the breast specimens of mucosa to know the status of the infection, at what extent it is spread. Next. And other relative diagnostic tests, like we need to know about the electrolyte status, the blood sugar, as diabetic is another comorbid state where a patient can have a high blood sugar and can again increase the criticality of the patient. HbA1c, A1c, renal function test, X-ray chest. Now coming to HRCT. HRCT is usually, it was it is not the confirmatory test for the COVID patient, but initially everywhere, it's every state we've seen, every country we've seen that HRCT was the first test they would do to confirm whether patient is having ground glass opacity and to confirm the COVID-19 positivity. But it is not like that. It is just to know the heart's lung status, how diffuse or consolidation is present. The ratio is been defined, and based on the treatment is been started. So it is not a very confirmatory test for COVID-19 patient, but it is just tells us the ground glass opacity, the paver block system, like consolidation of the lungs, that has been that reflects in the HRCT. Now ECG and echocardiography, again to rule out any cardiac cardiac findings, whether patient is having any cardiac problems, cardiac comorbidities. Next. Okay, now coming to diagnosis, clinical classification of COVID-19. Now, when we're going to talk about this clinical, the management of COVID-19 patients, the early diagnosis, treatment, isolation are the key points of taking care of this patient or managing this patient. The dynamic monitoring of lungs, imaging, oxygenation index, and cytokine levels. These are the most important point we need to keep it in mind and need to check on frequently and regularly to know the improvement or any progression of the disease. Next. Now this is about the classification of COVID patients. Now, depending on the presentation of the patient, the presentation of the symptoms of the patient, it has been defined in the mild disease, moderate disease, and severe disease. Now, in case of mild disease, there will be just a fever, or the saturation is maintained above 97% at room air. Now, in this situation, we just require the home isolation. Patient may not require the hospitalization. The contact precautions need to be taken, and the symptomatic management, like if fever, then the antipyretics can be taken, and further treatment. Like usually, this is the algorithms are given by the Ministry of Health, the Government of India, and which has been followed everywhere. Now this hydro SCQs 400 milligram BD on day 1, followed by 200 mg BD for 4 days, and this is all set protocols which we have, which may differ from institution to institution, or they may have their own protocols to treat this patient. So in case of mild disease, we don't require any hospitalization. But if it is a moderate and severe cases, definitely the hospitalization is must. Now, when we talk about moderate, we talk about the moderate disease where the symptoms of pneumonia can be seen, like patient's respiration will go high, more than 24 breaths per minute, and even the saturation, oxygen saturation will drop below 94% on room air. Now, in these cases, we need to admit the patient in the hospital. Patient will require the supplement, oxygen supplement, either by nasal cannula or even by non-rebreathing mask. Patient can carry on Then we need to rule out any comorbidities patient has, like by doing ECG, X-ray, okay? And the treatment like protocol as we follow, like chloroquine, then methyl like prednisolone, that is steroid, and certain prophylaxis with lower molecular weight heparin, and other diagnostic tests we need to carry on, like CBC, lymphocyte count, D-dimer test, ferritin, LDH. So to rule out like at what extent that disease has been progressed. Now, severe disease. In severe disease, its patient should be admitted in ICU. In this, the ICU criteria, like admission criteria, basically when there is, saturation, oxygen saturation is below 90% on room air, and there is more oxygen demand. If patient require oxygen more than 6 to 8 liter per minute, then patient should be admitted in ICU, in critical care units. Now, on admission, we need to assess the patient thoroughly, whether what is this patient requirement, oxygen requirement. Patient need to be started on HFNO2, that is high frequency nasal oxygen, or NIV, that is non-invasive ventilation. Okay, either there are different modes of giving oxygen. Now, when transferring to ICU, we need to see whether patient is a candidate for endotracheal intubation. If patient's saturation levels are dropping drastically in spite of oxygen therapy by either HFNO2 or NIV, we need to immediately intubate patient. Then we need to see about the other drug management, like including antibiotics. If patient is having any secondary bacterial infection, or patient is progressing towards sepsis, then remdesivir is another antiviral, which I will be talking about these drugs in detail later. Remdesivir, that is a 200 mg IV loading dose for first day, and followed by 100 mg IV for next 5 to 10 days. Then steroids like methyl prednisolone at 1 to 2 mg per kg per body weight for 5 to 7 days. Then like Clexane or Fraxipari or enoxaparin is 40 mg subcutaneous BD, that is low molecular heparin weight, has to be administered, and ARDS management should be started immediately. Now, this is in case of severe disease. If with all these measures, patient is still not improving, that case we need to further evaluate, investigate, and the drug can be introduced as tocilizumab, okay, which is anti-IL-6, interleukin 6, which is like basically help in decreasing this cytokine storm. And the convalescent plasma can be another modality for the treating severe cases. Next slide, please. The antiviral treatment, okay, basically we are using very commonly, it's a very famous drug, I can say it's a remdesivir. We have seen there was a lot of a shortage about this remdesivir, and while it was being used as a antiviral treatment, and it can reduce the incidences of severe and critical cases, but still there is no clinical evidence for this effectiveness of antiviral drugs so far. There are lots of researches being going on, and there will be many more other drugs or treatment modalities will be evaluated and followed by. Now there are other medications like lopinavir, then ribavirin, favipiravir. All these drugs are comes under category of antiviral treatment, and the test or the researches been going on further how effective these drugs are. Next slide, please. Now coming to depending on the patient's severity, at what extent patient is whether there is a sepsis setting or any other bacterial infection is being setting, then there is what is the patient's oxygen level, oxygen demand, that all need to be evaluated thoroughly. And for this, we need to use certain glucocorticosteroids, like that already I talked about methyl prednisolone. And there are certain special consideration in this treatment are we need to use proton pump inhibitors, insulin to to manage the diabetes or the sugar level of the patient, then antipyretics, anticoagulants, then trace elements, vitamin D, vitamin C. All this are the other supportive for the patient. For heart rate and blood pressure, if patient is hypotensive, beta blockers, vasopressors, but noradrenaline is most commonly used in this patient. Then sedatives and analgesia, if patient is on mechanical ventilation, ventilator, and we need to manage so less of trigger and must struggle with the ventilator, we need to administer sedatives. Next slide, please. Then another treatment modality is artificial liver treatment, which is used for the separation of cytokine cascade. Now, this artificial liver support system we have not heard about plasma exchange, absorption, perfusion, and filtration done by this artificial liver system. Also, this ALSs also provide this serum albumin, balanced fluid volume can be maintained, electrolytes correction and acid-base ratio also can be maintained through this ALSs. Also, it helps in improving the multi-organ function. Next slide, please. Now, coming to the practicality of how this ICU scenario will be, what is the clinical management? First important thing to manage the patient's oxygen level, the patient's oxygen supply and oxygen demand. There should be we need to assess it properly, thoroughly. For that, we have non-invasive ventilation. It can be BiPAP, then high-flow oxygen, like nasal oxygen therapy, then mechanical ventilation, can use a neuromuscular blockage, prone positioning, fluid management, then liberation from weaning from the mechanical ventilation, then tracheostomy if the patient is on long-term, on ventilator, then suctioning, like proper suctioning, close suctioning we require to use in such patients. Nebulization basically to prevent, it is not usually indicated, but the meter dose inhalation can be used in this COVID positive patient. Then bronchoscopy to understand, any bleeding then antibiotics and other rescue therapies we require to use. This is a overall clinical management which has been done in ICU. Next slide, please. Next slide. Okay. Now coming to the decision where we have to understand when patient will require an IV and when patient is need to be intubated. Now in this patient, suppose that if PO2 and FiO2 ratio is more than 150 mg, then patient should be we need to use an IV mode or high flow oxygen system. Now with NIV and or this high flow nasal oxygen system, if the patient is maintaining the vital tidal volume more than 9 ml per kg per body weight, or even respiratory oxygen index more than 4.88, then we can go on with this NIV or high flow oxygen system, and patient can be very comfortable and will be able we will be able to manage this patient with NIV or HFNC. But if patient is hypoxic and his tidal volume is between 9 to 12 ml per kg per body weight, and even this high flow oxygen system patient's respiratory oxygen ratio or index is between 3.85 to 4.88, then this patient we need to monitor very closely, because patient anytime going to severe hypoxia, and we need to electively intubate this patient. So close monitoring, though we can manage this patient on NIV and NIV this oxygenation, but still close monitoring is very much important. Now next, like patient is in very severe cases, there is a severe hypoxia even after on non-invasive ventilation, and this hypoxia is not improving, and there is no there's a strongly spontaneous breathing. The patient is using his accessory muscles for breathing, and respiratory oxygen index is less than 3.85. This is the right candidate that we need to intubate this patient immediately. The elective intubation has to be done. Now, once the patient is intubated, we need to see this. We need to protect this patient's lungs, for the further injury. So we have to have some strategy. We have to have some targeted values which we need to set it on the ventilator. Then lung recruitability and PEEP filtration is very much important. Now, lung recruitability, we have to be we need to use very cautiously, because it can further damage the patient's lung, further injure the patient's lungs. So it is very critical stage where we have to be very vigilant and alert of the patient's status. The next, prone positioning, again, which improves the lung recruitability, and there is certain method of positioning the patient. There are certain techniques we require to use for the safe prone positioning that I'll be talking about later. And very last resort is ECMO, that is extracorporeal membrane oxygen, which is just been initiated in our in India, and we are taking it forward. But it is lot to find out, or lot to research on this ECMO, how far it is beneficial, and what modalities we require to continue on ECMO. Next slide, please. Now, talking about the major intervention in ICU, that is NIV. Most of our patients see that with non-invasive ventilation, they tolerate it very well, and the disease process also can be reversible with proper use of NIV. But we should know which are the candidates, or which are the patients will be beneficial for NIV, and which are the patients require the elective intubation. So we should be very sure about it, so that we are not damaging, or we are not further damaging the patient's health status. Now, goals of NIV, we need to resolve. What are the goals of NIV? So resolve and improve the gas exchange. That is the most important goal for improving gas exchange. Then unload the respiratory muscles. Basically, it is a positive pressure being given to the patient, where patient will not have to use his accessory muscles spontaneously, and that will give that will be a beneficial for the patient to improve the gas exchange. Then decrease dyspnea. Now, certain complications can be avoided because of NIV, like infection, ventilator associated pneumonia, because it is non-invasive. Then definitely we will see the improved clinical outcomes with use of NIV. Then early ventilatory support and overcome of auto PEEP. Now, these are the goal of NIV. Next slide, please. Now, what is the mechanism of non-invasive ventilation? There is a reduction in inspiratory muscle work and avoidance of respiratory muscle fatigue. As I already said, it is a positive pressure being given to the patient, the muscle, that fatigue will not be there, and patient will be very comfortable. Initially, patient will have difficulty when he is taking that positive pressure, but gradually patient will be very comfortable. Then it improves the compliances by reversing microatelectasis. Then it overcomes the intrinsic PIP. It enhances the cardiovascular function. There will be a afterload reduction. Then it reduces the carbon dioxide production. So these are the mechanism. Now, what are the prerequisite of using non-invasive ventilation? Now, prerequisite means we need to prepare the patient for NIV. It is not very easy that you just attach the mask and you start with it. It is not like that. Patient need to be cooperative for this this method, because this, when we are going to provide the mask, when we are going to apply the mask over the patient face, patient will feel that suffocation. Patient will have that suffocation because of high pressure created inside the mask. So the patient need to be very cooperative, otherwise it will not have any effect if patient is not cooperating. Then patient should have spontaneous breathing. Patient should have his own breathing. If patient is drowsy, not able to breathe, or patient is tired of breathing, then it will not have any effect. It will not improve patient's oxygen status. Then hemodynamically, patient should be stable. All parameters should be stable. Then targeting the carbon dioxide level should be less than 50 mmHg, and pH should be less than 7.3. The gradual improvement, it will be seen within first 2 hours. If patient is not improving and still there is a deterioration, then we need to move on to the next modality. Next slide, please. There are certain contraindications for non-invasive ventilation. There are absolute and relative contraindications. Now, absolute contraindications like patients having respiratory arrest or patients having unstable cardiorespiratory status. Then there is unable to protect the airway, or there is impaired swallowing and coughing. In that case, we will not be able to apply NIV. Then there is a craniofacial trauma or burns is there. Then anatomic lesions of upper airway is affected. Then again, it is not possible to apply non-invasive ventilation. The relative contraindications like extreme anxiety, patient is very anxious, not able to stay with that pressure, with that mask. Then very uncooperative patient again will not have any effect. Patients having a lot of thick secretion, copious secretions. Then there is swallowing impairment, multi-organ failure. All these are the relative contraindications for non-invasive ventilation. And there is need for the continuous or nearly continuous ventilatory assistance. So these contraindications, we need to keep it in mind, and as per the criteria, we need to apply this non-invasive ventilation. Now, next slide, please. Before applying this NIV, the mask selection is very, very important. As a nurse, we should be very alert, cautious to know what is the size, what size of mask will be appropriate for our patient. Because in any small leak also will not give that effect, or it will not improve the oxygen status of the patient. So there are different sizes are available in this NIV mask. We have small, then moderate, small, medium, and large mask available. Okay, so based on the face of the patient, how small, how big, we need to select the appropriate mask. And if you have seen this, pouch of this mask, there is a scale over that, in that cover. So you can use that scale to measure the, size of that patient is, as I have showed over here, this blue color. Okay, the scale is there. So you can actually just, measure it. And as per that, you can select the this oxygen mask, this NIV mask. Now this mask are in two types. We have vented and we have not vented. Now when you are going for the BiPAP, this vented mask to be used, and for NIV it is non-vented mask to be used. So that difference you should be able to find out. You as a nurse, you should be aware about. Next slide, please. Now, there are certain tips we need to remember, certain special precautions we need to take when we apply this oxygen mask. Before applying, we should know how comfortable, how cooperative a patient is. Then explain to the patient the modality, and we need to reassure the patient that it is for his benefit, and initially he will feel suffocated, but then he will be comfortable later on. So we need to stand with the patient, throughout till he is comfortable with the mask, an IV mask. Then hold the mask in place until patient is comfortable and synchrony with the ventilator. Then passage of 2 fingers beneath the head straps. So because it should not be very tight, that make the patient feel very uncomfortable. So you should check after application, you should check whether you can pass 2 fingers between this strap. Then skin patch to minimize the abrasion and necrosis over nasal bridge and skin. So many of the times we see Hello, you can hear me?
Yes, ma'am, we can hear you.
There is some technical problem again.
Yeah, sorry.
Yes,
Yeah,
ma'am, you are audible
you're
to
audible?
us.
You're audible. Yeah, I'm audible now.
Yes, ma'am, yes.
Okay. So to continue with this, application of mask, again, we need to check, lots of, we have observed in our ICU also that because of this mask, continuous, use of mask, there is a necrosis over the nasal bridge, or there's a skin abrasion because of the, pressure. So in that case, we can use these skin patches, over the nasal bridge, and over that the mask can be applied, especially to prevent MARSI. That is medical adhesive related skin injuries that we need to prevent. Now, after this, then head of the bed has to be elevated, always, because patients should not feel, suffocated, or should not feel uncomfortable. So head of the bed has to be always elevated. Then secure the mask, avoiding tight fit. So it always, patient should feel comfortable. After application, we need to ask the patient how, whether he is comfortable or it is hurting, so that, we are assured that it is working properly. Next slide, please. Next slide, please. Yes. This is a high flow nasal oxygen system, which is commonly used in this, COVID ICU. You can see this is how it looks like. Okay. There is a flow meter over it, which tells you how much oxygen the patient is receiving. This nasal interface, which is attached to it's a nasal prong, which is attached to the patient. We have a humidifier. So the humidification of, patient will get the humidified oxygen. And these are the inspiratory tubings. Next slide, please. Okay. Now, if you've seen this nasal high flow nasal oxygen system, patient feel very comfortable with this oxygen system, and this system also provides nearly 60 liters of oxygen per It's gone. Okay. 6 liter per minute. And patient also feel very comfortable. Patient have a lot of freedom. Patient can eat, can talk, can drink with this high flow oxygen, system. But the thing is that in this system, patient, we will not be able to deliver high pressure oxygen to the patient. So the effectivity and the utilization or the indication of this, we need to be very careful about as compared to non-invasive this BiPAP or CPAP, there the high pressure has been delivered passively, but in high flow oxygen there is lots of wastage of oxygen also happens if patient will not have a spontaneous breathing. So this need to be carefully monitored, and we need to assess the patient frequently when patient is on high flow oxygen system, nasal oxygen system. Next slide, please. Now coming to the mechanical ventilation. If our all other measures fail, patient is not maintaining saturation with NIV, with high flow nasal oxygen system, then we have to electively intubate the patient. Now this is the protocol of mechanical ventilation, which is available on the system, or you can go through it. There are many other protocols related to mechanical ventilations available. Now, when can we intubate the patient? If the patient's oxygen saturation drops below 90%, then and patient's oxygen demand increase more than 40%, like FiO2 more than 40%, we need to assess the patient, need to check, patient, need to see patient's work of breathing, and we need to intubate the patient electively. Now, initial settings on the ventilator, basically it depends from patient to patient, according to the patient requirement. The tidal volume usually 8 ml to 8 ml per kg per body weight. Then PIP 8 centimeter of water. Then driving pressure should be less than 15 centimeter of water, and respiration should be kept around 18 to 20 breaths per minute. Now, in this case, if we need to closely monitor the patient and assess the patient for any requirement of any inotropes or further medical or drug management, like fluid requirement or patient require any other inotropes. So all that assessment is very important. Now, if the patient's saturation drop below 90% with FiO2 of 60% or PaO2 and FiO2 ratio between 150 to 200, then we need to increase the PIP setting step by step, 2 centimeter, 2 centimeter of water, depending on the patient's lung status. The target, if you see the target values, that we always need to keep it in mind, how much it should be. And based on the patient's response to the mechanical ventilation, we need to do certain changes. But the scenarios always depend on the patient's condition, situation to situation. Now, there are two types of pneumonia we can identify in this. Okay, that is L-type pneumonia, which is which is why it is L, because it is low elastase in pneumonia, and H-type of pneumonia. When we talk about L-type of pneumonia, where it is more of patient is manageable on the ventilator and the condition can be reversible. In this case, patient can be given prone position, then patient ventilatory settings can be adjusted depending on the patient's comfortability. Now, H-type pneumonia, which is more of ARDS and which is very severe, where patient's tidal volume, we need to decrease the tidal volume because more tidal volume will damage the lungs further. So we need to decrease the tidal volume about 6 ml per kg per body weight.
then consider that, PEEP adjustment, and consider the recruitment, lung recruitment. What happened? Okay, this H type of pneumonia, which is more severe. So we need to be very careful. We need to be very careful when we are, adjusting the settings on the ventilator. Next slide, please. I'm not able to see the presentation.
Ma'am, again, we are facing technical issues, so I will share the slide again.
Okay. Some technical issues there. I'm not able to see the presentation. From their end. From there. Okay. Yeah, it is visible now. Okay, thank you. So coming back to mechanical ventilation, when patient is been like electively intubated, or patient, we need to intubate electively, we need to keep certain things ready. As a nurse, we should be aware about what measurements we require to take. Our intubation trolley, our intubation tray, crash cart, all emergency drugs should be ready beforehand, prior. Then this is, you can see the intubation, like the intensivist is doing intubation. Either we can use the transparent drape for the intubation, or there are intubation hood, so that aerosolization can be prevented. So these are the safe methods for the intubating COVID patient. Next slide, please. Now, major goal for mechanical ventilation is to balance the ventilation and oxygen demand and risk of lung injury. So this point we need to keep it in mind, because anytime if our settings are not proper on ventilator, we further can damage the patient's lungs, because lungs are already injured and very delicate at that moment. And we have to be very cautious about when we are changing the settings, or patient starting on the mechanical ventilator. So as already I talked about this target values, like tidal volume should be between 4 to 8 ml per kg per body weight. The lower the lung compliance, the smaller the preset tidal volume. That always remember. Then plateau pressure should be less than 30 centimeter of water, and driving pressure should be less than 15 centimeter of water. Now PEEP is another category where we have to be very careful, because high PEEP again can damage the alveolar, and lung injury will be possible. So we need to follow the ARDS protocol, that every institution has their own protocol, can be followed based on the patient's condition. Now, ventilation frequency should be 18 to 25 times per minute, and we need to administer sedation, analgesia, muscle relaxant, okay, to if tidal volume or the blood pressure is high. Now, coming to the lung recruitment, is not very routinely done in very severe cases, because it can further damage the lungs and can cause the circulatory complications. Coming to the next modality is prone positioning. You can see it's very, it's like technique. We have to be very, very careful about this technique, and we require lots of, manpower. Usually 4 to 5 people we require for the positioning, prone positioning. Next slide, please. So we need to have people around, help around before positioning a patient in front of this. Then we require to confirm where all the required equipments are there available. We have to have set checklist before proning the position. Then we need to pre-oxygenate the patient with 100% oxygen before proning. Then we need to ensure that all lines, catheter, tubings are properly secured and placed properly, so there is no disconnection at the time of the positioning. And it is called Cornish-Pasty technique, which during, in this proning, where we require to use 3 pillows and 2 sheets placed on beds like this. You can see the picture, okay? So basically to avoid the abdominal pressure and give a proper support to the patient. Now in positioning, we need to make bed flat, should be in a neutral position. Patient should be in a neutral position. Then ECG, electrodes and all other catheters to be secured properly. You can see the picture here. So, and it should happen, at the time when we are turning the patient, when with the help of the sheet, it should be properly synchronized at that moment. And we need to be very careful. We need to support the head. If patient is on ventilator, one person should be there at the head end, supporting the patient neck and tubing at that moment. And once the proning is complete, then we need to check whether all your catheters, we need to check how the patient's response is, whether the patient is responding, the oxygen status are not dropping, or, patient is very comfortable with proning. So all that has to be checked when we are proning patient. And it is a technique basically used for, improving the oxygenation of the patient. Next slide, please. The next goal is prevention of regurgitation and aspiration. Now, if we've seen this patient basically require, when they come to ICU, their oxygen demand is very high. And patient is on NIV, where the lots of gas is being inhaled and is being taken in the abdomen, where there will be a lots of discomfort patient may face with this positive pressure. So continuous this nasogastric decompression is very important, and the Ray's tube, nasogastric tube should be in place so that patient will not have any regurgitation or the aspiration. The positioning of the patient should be such a way that we have to prevent aspiration. The next is fluid management. Fluid management or fluid restriction, or we need to be very careful. We need to assess the benefit and risk for fluid management. If patient is already like having a hyper like patient overloaded with the fluid, then it is going to impact on the cardiac status of the patient. Then that in that case we have to be very careful. Plus, if patient is in hypotension, dehydrated, in sepsis, we need to see that adequate fluid has been given to maintain that fluid status of the patient. So fluid restriction required to basically reduce the pulmonary exudate and improve the oxygenation. But the assessment is very important, whether we require to give patient fluid, but not to overload, or there should not be any deficit as well. Next, then strategies to prevent ventilator associated pneumonia. Every nurse at the bedside should be aware about this care bundles. We back care bundles which we follow. Like we have, there are 5 points in this care bundles included. The head end of the bed, 30 degree elevation of the head end of the bed. Then oral hygiene should be maintained of the patient. Then there's subglottic suctioning is very important because of the collection of the secretion. There will be a colonization of the organisms, and that further can lead to infection or VAP. So all these points we need to be very careful and need to follow strictly. The infection control policies should be in place and strictly should be followed. Now, after this, coming to next goal, that is ventilation, winning from the ventilation. Winning from the ventilation of COVID positive patient who is severely ill is a challenging role for everybody. Like it is not very easy as such, but we need to check, we need to follow the awakening protocol or sedation protocol, or weaning protocol for that matter. We need to reduce the sedation if patient is on sedation, and we need to see after extubation, we need to support this patient either with NIV or HFNC so that their oxygen status are improved. The rational use of antibiotics is another goal of critical management to prevent the secondary infection. We just cannot give left and right antibiotics, but we need to be very careful when we are administering antibiotic, and the selection of antibiotic is very important. Next slide, please. Now, the next goal is to balance the interstitial microecology. Microecology means already patients in GI system, is affected. Plus the antibiotic administration, like vigorously used antibiotics also can damage the patient's intestinal normal flora, and again can lead to the complications. So we have to be very careful in managing this. We can add into probiotics to take care of this intestinal microecology. Starting nutritional support, starting on intestinal nutrition as early as possible is very important to secure the intestinal flora. Then enteral nutrition pathway we need to follow, and appropriate selection of nutrient solution. Patient's nutritional status has to be maintained. So we have to have a plan for the nutrition, how much calories patient will require, how much energy patient requires, what type of nutrition patient require, whether it is parenteral nutrition, enteral nutrition, all that decision need to be taken. It is a multidisciplinary approach to decide on overall, what modality and treatment patient require. Next slide, please. And the last, think about the ECMO support for the COVID-19 patient. To start ECMO is extracorporeal membrane oxygenation. There are many things need to be, we should be ready to accept this patient because there are many things we need to start on this, preparation. The time and means of intervention, whether patient really require, this mode of management, or how the anticoagulants and bleeding status of the patient. We need to check whether patient can be coordinated with the mechanical ventilation along with ECMO. There are ECMO protocols we need to follow. Early rehabilitation training is important, and strategy of handling complications. Now, for this ECMO, we had to have an expert ECMO team to manage this patient on ECMO. Like we have to have an expert perfusionist, expert, clinicians, expert ICU nurse to assess and find out and recognize the early complications and manage it. Next slide, please. Next slide, please. The psychological intervention with COVID-19 patient. As Madam Sai already spoken about the psychological intervention which required for the patient, it is very important, like, to make the patient mentally stable, because as such the disease itself make the patient anxious, and patient is very irritable, non-cooperative, and all those will not help the patient to improve on the practically or physically with all these modalities. So the counseling of the patient is very important. Now at our institution we have an empathy team where the doctors and senior nurses are involved in this team, where they go and visit the patient, talk to the patient, boost up their morals, and prepare their mind for all these modalities, so that it is convenient for even doctors to manage such patient. Then rehabilitation therapy is very important after this post-COVID. Rehabilitation, we need to assess the patient, what type of rehabilitation patient require, what type of exercises patient require, how far patient can bear these exercises, what is the strength, all that assessment is very important. Then positioning and postural drainage, which is a part of chest physiotherapy, is important. That patient need to be, the relatives need to be taught about it. So after this, they need to continue it throughout. Then respiratory exercises, certain exercises, spirometry, deep slow breathing exercises, all that need to be included in the rehabilitation. Next slide, please. Okay, so that is all about the management of the patient in the COVID, with the COVID. This management also again depends on the organ involvement of the which are the organs involved in the this disease. Suppose it is cardiac, there is a pulmonary impairment, there is a cardiac impairment, renal impairment, where we require to check on patient's acute kidney injury. We need to start the patient on hemodialysis or CRRT or SLED. So all this management modality we need to check on, and as per that we need to take the right decision of what treatment does our patient requires. Now coming to the end, to conclude, like this COVID-19 is its most challenging health emergency that we are facing right now, and it is very difficult time, and with the limited resources and information we are going forward, and there are lots of things, lots of clinical practices are happening. So early diagnosis, application of effective therapies, and adequate strategies of this clinical stratification is very important to improve the better or to assess the better outcome of this COVID patient. So here I stop my presentation, and thank you very much for giving me this opportunity to talk about it. Thanks a lot.
Thank you so much, ma'am, for sharing us in-depth knowledge about the symptoms and also the treatment modalities and pathophysiology of COVID-19 in detail. We have gained a lot, ma'am, from your topic, and I hope everyone also have understood clearly about your topic, and I would like to apologize for the inconvenience and interruptions which has been made from our side, ma'am. We are really sorry for that. And I would like to apologize to the participants as well for having patience and then being there with us. So now I would like to open the session for discussion. So if among the participants, if there is any doubt or if any queries, you can drop in the chat box. Participants, please clarify your doubts if you have any. Okay, I hope everyone has understood the topic clearly, as I'm not able to see any queries in the chat box. So now,
Hello, Saino.
Yes, ma'am.
Okay, is Madhuri there? Hello.
Yes, I'm here.
Yeah. Okay, this is Manashri. Sorry for the interruptions in the initial, because as I mentioned, there is so much of technical problems in our whole university campus.
I know.
So yeah, so like my sincere thanks to Sister Belinda for giving you the opportunity to meet virtually and to listen from you. I just would like to add up, because at a medical surgical nursing like specialty nurses and really as a critical care nurses, what I feel like whatever you have taken from the like starting from your introduction till the end of the topic, like I was just going into a glance like how much it is useful and how much it is essential for a nurse who is really interested to work in ICU. Because I would like to add up here in the when there is a high peak in the month of April and May, I would tell you that my husband is also in the same condition. He has gone into ICU. He has been given an IV. And while going through your slides, I was just correlating the scenario, because I was also with him in the ICU for near about 10 days. So I can feel like how much it is important for a critical care nurse who is really interested and who has the zeal to work in this ICU setup, who has that confidence, and they are committed. So definitely those young generation nurses will definitely shine, and what I feel, whatever we learned as a critical care nursing specialty, like this ECMO, this new generation nurses, they should take up this type of extra certification course, so that whoever is having the interest to be in the bedside, to have to gain more and more of confidence, they should attend this type of workshops and training. And not only that, hands-on practice is very much important, because we are now in the academic side. But what I feel, the more learning thing, bridging the gap between the theory, because so many things we learn from the books, but actually when you are in the setup, the things are totally different. Handling the cases, taking decisions right time is very, very important, what I feel. So it is my earnest request to all the participants, young generation nurses, if you are having the zeal to come up with a dedicated part of critical care unit, then from the beginning as a student nurse only, you try to have that type of commitment, confidence, and with your knowledge and expertise, definitely one day you will be a successful one. Yes, Madhuri, am I correct?
Yes, yes, absolutely, absolutely. Now, whatever I have presented, it is just a small part of it, but it's very extensive. If we go to the ICU management, it's very extensive, and very interesting rather. So I really would like to tell the students that please take up and learn more and more, because it's really gives you confidence when we see that our patients are coming out of this
Yes.
and it's really happy feeling rather, I can say, when patient go home and with all fit and fine. So
Yes,
I
that
think
is what is our most important job satisfaction.
Yes, absolutely, absolutely. Thank you, ma'am. Thank you for giving me all this.
Thank you so much. And please, I'll tell regards to Belinda also, because
Sure.
we are connecting from our BM Villa time. So thanks a
Yes.
lot and keep in touch.
Yes, sure. Thank you so much.
Thank you.
Now we have come to the end of today's first half session. So now I'll be winding up the session. I would like to request all the participants to join back again exactly at 1 p.m. We will be having a short lunch break now. So once again, thank you all. Thank you, honorable speakers, Dr. Sai Lakshmi ma'am and Madhuri ma'am. Thank you, all of you. Please rejoin again exactly at 1 p.m.
Hello. Hello, ma'am. Hello.
Hello. Yes, ma'am. Good afternoon, ma'am.
Hello.
Good afternoon, ma'am.
Yes, ma'am. When it is the last session?
The last session will be from 1 o'clock.
From 1 o'clock. Okay, okay.
Yes.
Thank you.
Yes, ma'am. Okay, ma'am.
Okay. Hello. Ma'am. Hello. Wait a minute. Hello.
Hello.
Oh, ma'am.
Oh, yes, yes.
Ma'am, you can display my slide. Just I want to check that.
Oh, okay, ma'am. Okay, ma'am. Sure, ma'am.
Yes, yes. Okay, ma'am.
So, ma'am, should I share it from my end or?
Yes, you can share it, ma'am.
Oh, okay, okay, okay.
Okay, you put in first slide into that first slide.
Yeah.
Yes, that's enough. At
Okay,
1
ma'am.
o'clock sharply, we can start now.
Yes, 1 o'clock. I'll just address the participants, then I will give time to you, ma'am.
Okay, 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 pa.
Okay.
Good afternoon, ma'am.
Good afternoon, ma'am.
Good afternoon. Thank you for joining, ma'am.
I will there in hello.
Yeah, ma'am.
Ma'am, I am already is there.
Yes, 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 yes. I can see you. That's what I just wish you.
Oh, okay, okay. Thank you.
Okay. Thank you.
Good afternoon, everyone, and welcome back to the second half of today's program. I, Ms. Zilan, am humbled to address this virtual gathering, and I am privileged to introduce our last but not the least speaker, Dr. Bhuvaneshwari Madam, who will be taking us through the topic Swift Direction of Rural Community Response to COVID-19. I would like to introduce the speaker for the session. Dr. Bhuvaneshwari G. Madam is currently working as an Associate Professor, Community Health Nursing, Savita College of Nursing, SIMAT, Kandalam, Chennai. Ma'am has received both her PhD in Nursing in 2019 and MSc Nursing in 2009 from Savita Institute of Medical and Technical Sciences itself. To give out our speaker's professional summary, Ma'am has more than 13 years of experience in teaching and research in the field of community health nursing. Ma'am is enthusiastic in motivating the students to develop their full capabilities in their studies. Ma'am is dedicated in engaging the students in learning process. Ma'am also enthusiastically takes keen interest to involve in the university development programs and also in community outreach services. Ma'am has been trained as non-AHA, BLS and SELS provider and has attended simulation-based learning in Simulation Lab in Savita University. Ma'am has presented many scientific papers in national and international conference and has published more than 65 articles in Index and Scopus journals. Ma'am is contributory editor of TNMC, Journal of Community Health Nursing, and other international journals. Ma'am has been actively supporting students' research programs and maintains extension of research activities. Ma'am is guiding both undergraduate and postgraduate students for their research work and also guiding 6 students pursuing PhD in nursing currently. Ma'am is diligently providing content validity for PG and doctoral research scholars, served as an examiner for both undergraduate and postgraduate in various universities across India. Ma'am has been invited as an observer for the various conferences and workshops. Ma'am is a recipient of Best Researcher Award in 2019 and a recipient of Outstanding Research Supervisor of the Year in 2020. Ma'am has also received an Appreciation Award for her recognition and commendable services in Savita College of Nursing on the occasion of Silver Jubilee celebration. With this, I would like to request all the participants to give your fullest interest to Dr. Bhuvaneshwari Madam. Over to you, ma'am.
Thank you, madam, for elaborated information about me. First of all, I thank our management and also our principal madam and vice principal ma'am and the well-wisher of Dr. Tenmoli ma'am offering this opportunity to privilege to present this topic here. And also I thank the principals to given this opportunity to share my knowledge in this international CNE. Yes, today my topic is rapid rural community response to COVID-19. Is already we saw in past 2 days so many crises, so many what are the COVID-19 history and also how it will be affecting, then how it affected in this the population, then how they are in this the hospital crisis, and also how that pediatric children are suffering in forthcoming days. Everything is we saw in this fourth session. Now we will start about how the community going to spreading this rural COVID-19, that we will see now. The rapid rural community response to COVID-19. Yes, this is a every major crisis such as the COVID virus pandemic bring opportunity to rethink our system and make them more resilient to future shocks. This is also true our rural region. Rural economic have provided essential goods and services, including the food and energy to household, hospitals, and health centers during their confinement period. In some countries, the rural areas have also served as a temporary but safer location for these urban travelers. Taking a longer perspective, the pandemic can change the consumption and the production pattern, remote working habits, and forms of mobility, which may open new opportunities for sustainable growth in rural regions. Yes, now we are revisiting the globalization of the production chains could also open new opportunities in some rural areas. Yes, we will see about this. Next slide, please. First slide. Excuse me. Hello. Hello, ma'am. Hello. Are you hear me? Audience? Are you hear me?
Yes, ma'am.
Okay.
Yes,
Okay. Okay, you can change the next slide. The global burden of the pandemic COVID-19. How we are suffered in past 2 years. That today incidence of the globally they have been 19 lakhs 24 19 crores and 24 lakhs and 90,038 confirmed cases of COVID-19. Please change the slide, including the 41 lakhs and 37,505 cases were death. In Southeast Asia regions, according for 3 crores 73 lakhs and 43,828 confirmed active cases, and also 5 lakhs 43,605 deaths were reported in the census of July 23, 2021 green wise meantime. Yes, next we will see about this, how it will be affecting in this India. Please change the slide. Now I am in 5th slide. Ma'am, please change the slide. Okay. So magnitude of the pandemic COVID-19 in India. The India reports 1,29,813 confirmed cases with the 7,471 deaths. The active COVID cases have declined to 4 lakhs, 0.7 lakhs in India. The infections are going down every day. Active cases constitute 1.3% of the total infection. 36,977 patients recovered in the last 24 hours, taking total recovery so far over the 3.0.4 crores were reported in the time in the data. Is that this sources is taken by this July 2021 in this green wise meantime. Next, we will see about this, how the trend in urban and rural areas. Yes, the COVID-19 cases are in urban and rural areas. A report by the state. Next slide. Next slide. A report by the State Bank of India noted that the rural district accounted for the 50% of the all new cases in the country. In rural area of the Amaravati in Maharashtra are most affected with a large number of the new cases, and those of the Nagpur in the same state have reported also becoming hotspot. The second wave also hit in the rural area of the Gujarat. The state reported that 90 deaths in the 20 days in the same village alone. The Chaco, which has a population of 13,000, the total of India's largest and most popular states, the Uttar Pradesh and Bihar also are witnessing speed of rise in this COVID-19 in their rural districts. Next slides. How we have to, who are all the vulnerable in this rural region? Yes, we will see about that, who is having the higher risk for the severe illness, mainly notable for the elderly and poor, mainly the high risk populations in this rural area, and also who is having the less economic, very poorest, low socioeconomic or low poverty line, or otherwise the below poverty line, who are living in this rural area. The persons are vulnerable. Much diversity in the economic, and also they are not having this essential job Mainly, the persons are working in the coolie or otherwise in this the farmers. The limited capacity to undertake these jobs from the home due to this lockdown. This makes the telework and social distancing much harder to implement. And at the same time, lower incomes and lower savings may also force the rural people to continue to work and not visit the hospital when they needed. Next slide. So health centers at the same time, lack of the health centers and lack of the ICU, mainly the health infrastructures is not at all available in this properly available in this rural area. Mainly the health centers are typically not well suited for the dealing the COVID-19 because of they are lack of the ICU and a skilled doctor, and also the specialized skill and adequate medications are not having in this particular in health infrastructure of the rural community. The larger distance, at the same time, larger distance to assist the hospital, testing centers, etc. These are also one of the main reason to the rural people are much of affected in this COVID-19. A larger digital divides with the lower accessible to internet, both in coverage and connection speed, and fewer people with adequate devices and the required skills to be used. So ASHA or ANMs are working in this rural area. They are not having the proper mobile phones and the proper networks, and does not having this having the correct stipend of this particular ASHA workers. So these are all the main reasons we cannot reach the rural people. They are going to affect the COVID-19. So vulnerable, these are all the vulnerable areas to the rural people are affecting this COVID-19. Next slide. The impact of the disease, how it will be going to impacting the people. Yes, while disease can make everyone sick and someone are more at risk of getting an infection and developing severe complications due to their health and social and economical circumstance. Mainly this time, the COVID-19, anyone, whoever we have to see the person having the spread of the inspection through this urban to rural, people, anyone can get the sick at the same time, more at the risk of getting the COVID-19. At the same time, the third wave, how we are still learning about how it affects the children, that we will learn today also. At the same time, how the impact of the COVID-19 will be affecting, next slide, Pa. Impact of the COVID-19 will affect the in our world. At the same time, physical and mental impact of the COVID-19. Please change this. So physical and mental impact of the COVID-19, while we are in the downward slope on the first wave of the virus, and its direct physical impact on the health of the people in society, and also we are in this the third and fourth waves are only beginning. These waves also for the border and longer term impacts on the mental health and well-being of the people. So see this picture already we saw that is the while downward slope of the first wave, and also we are starting that we are crossing the second wave, and also we are in this beginning of the third and fourth wave. So what are the main mental impact will be occurring means the main mental impact means there is the impact of the interrupted care on the choice conditions. At the same time, in the fourth wave, physical trauma and mental illness and economical injuries and burnout, everything will be occur in this fourth wave. So we have to fully design these pictures, that is a physical and mental impact of COVID-19. Next slide. So in this the first wave, how we have in this first wave, in the past COVID-19, the first wave, how we are in that. So once we got from this COVID-19 from the China, from the Wuhan, so we are affecting through this travel from travel from through this India. So it will be a pandemic. So it will come into this India. It affected in this India. The India under the influence of the COVID-19. So what is the main next step? We are going for the preventive measures and taken there the impact. So preventive measures we are going. Our government, our Indian government is central government is announced for the lockdown from the March 21st. So in the lockdown is mainly caused for the many people's impact of this lockdown. Many people are suffering from the urban and rural areas. They are in the rural and the urban areas. The purpose is return back to the migration. The migrated people return back to their own place and also it leads to for the no shelter, no food, and no money, and no transportation, and chance of getting the infection more. This is the first wave impact. Next, we will see about that how the second wave impact will be there. Please move the second next slide. Okay, impact of the COVID-19 during the second wave. Already we know what are the main crises will occur in the second wave means. So panic on the COVID testing. So the people are having the symptoms, but they are not going for the testing. At the same time, they are fear and also anxiety how it will be affecting our society. About this COVID-19. So panic on the COVID testing. At the same time, acute shortage of the beds and the medical oxygen. More people are waiting for the bed. They are waiting in the corridor or in this roadside of the hospital, the oxygen administration and giving the medications, and even though they're giving the CPR in this roadside and also waiting for the hospital admission, they are working. Severe people are waiting in the ambulance itself. So the persons are more afraid about this disease. At the same time, oxygen crisis. In this oxygen crisis, the ICMR reporters says that first wave there are 41.5% oxygen require only is there comparing to second wave. The second wave 54% of this 54.5% oxygen needed in this affected patients, affected COVID patients. So this this report is given by this ICMR. So oxygen crisis very very crisis in this particular situation. At the same time, loss of loved one. So most of the age group, mainly the affected from this 35 to 50 years, more people are suffered. And at the same time, they are lastly family members also. It is a very more crisis on the second wave. At the same time, rising of the COVID death, the mass cremations will be occur, even though they are cremation will be done in this Ganga river itself, river also. So these are all the main crises will be occur in this second wave. Yes or no? Audience, you are listening or not?
Yes, ma'am.
Okay. Next, impact of the COVID-19. Please change that. What are the challenges in this COVID-19 rural area during the second wave? Mainly fear among the public regarding the contrasting the COVID-19. So if it is in my house nearby next neighborhood, they are having the COVID-19 means in this the total black will be going to what they are tracing that. So the time they are lockdown will be announced that particular area. So what they are going to do, the time the fear why once we are getting this COVID means they are come under focusing on us also. So that reasons the most of people are having the fear among the public tracing. At the same time, contrasting of the COVID-19, at the same time, lack of the testing facilities and delay in this reports and result in the possibility of the further infection. At the same time, lack of the essential medications in the particular region, even paracetamol also we are not getting in this pharmacy, in the medical shop nearby in our place. At the same time, vaccine hesitation will be there in the second wave. Now only we are going to we are showing the willingness to get the vaccine. But the second wave, they have started giving the vaccination, but that time the public and all not receiving the vaccine at the same time. They are if the government people are come and give the vaccination is they hesitated to get the vaccination in this particular situation. So lack of the facility at the hospital also. So hospital in the while we are going to contact in this sub center or primary center or community health center, there is no medications. At the same time, there is no pulse oximeter and oxygen supply in this particular primary health center and sub centers. So this is the lack of the facilities in the hospital and reverse migration with the limited monitoring and testing system in the place, unlike last year. The same like the fear of the lockdown and losing the income and livelihood of the resources. These are the main challenges in the second wave. At the same time, in India, poor northern states, some villages have the dumped in the bodies of the relatives who have died of the COVID-19 in the scattered in the Ganga rivers. Others have filled in the cattle shed or farms near the only space where they are can socially distanced. This is the main challenges in the rural area during the second wave. Is or no? Next slide, please. All are had the lunch. Audience. So what is the current government strategy? Yes, the following are the key actions listed in this strategy. The ASHA workers. Who is the ASHA workers? Who is the ASHA workers? ASHA workers are working in your area. Audience. Hello. Listening. Everyone is listening.
They're working on.
Yes. Okay, ma'am. So the ASHA workers to be trained by the Panchayat Raj institution to identify yearly sign of the COVID-19. At the same time, we have the government strategies to introduce the self-help group, women's self-help group to be utilized for the promoting awareness and symptoms of COVID-19 appropriate behavior and all. We have to talk. They are training giving to them. They have to teach in the rural people. At the same time, test, triage, and treatment. The test treatment mechanism for the screening and isolation referrals of the cases must be strengthened, along with the monitoring of the home isolation cases and facilities for the COVID-19 care are to be ramped up and focused on the medical health. So this is three main criteria. And next slide. So next slide. The state health administrator to triad patient in order to reduce the mortality rate, mainly the IMS. IMS means that is Indian registration medical information system. So in this we are gathering the surveys and we have to update it in this central government. So they have to focus on this particular which area is more affected in this rural area. They have to focus on that. They have to reduce the preventive measures to reduce the mortality rate. At the same time, the vaccination to be stepped up, especially for those above 45 years of the age, and ASHA workers and black medical officers to mobilize the population from the particular rural area. The central and state government schemes to be leveraged for the providing food rations and also drinking water and sanitation, and also employment under the Mahatma Gandhi Rural Employment Guarantees Act, and linkages with the medical facilities in the nearby the district or sub-district to be established in the emergency services. And next slide. And also trial structure to be set up. There's COVID-19 center for the mild cases. They have to treated in the sub-center, and moderate cases will be treated in the community health center, and severe cases will be treated in the district hospital and sub-district hospital, and also the tertiary hospitals. Mainly the ambulance made available to the rapid transportation of the patients also is the treated structure of the setup, and also use of the drones to the exploit to the delivery vaccination in the remote area and the isolated communities. These are all the main government strategies. Now they are functioning now. Now they are following this government strategies. Next. So what are the challenges in this COVID-19 in this villages? So COVID-19 challenges in India, mainly the villages are health infrastructure, human resources, and public investment in healthcare, data collection and dissemination, food insecurity, and economic crisis. This is a proportionate impact on the women and migrant labor and societal activities. These are all the main area we have two challenges in the village side. So in the village side, we first will see about this health, that is health infrastructure. Let's change the slide. This health infrastructure. So in the basic health challenges in the rural area, health infrastructure is mainly according to this, every 30,000 population, one primary health center will be there, and also 5,000 to 3,000 to the 5,000 population the sub center, and community health center in the above 1,20,000 population we have to require for the community health center. But during our pre-COVID also there is a required health facilities needed in this all the communities. So you see this picture. Mainly these COVID-19, the sub-centers are required places in 1,91,461 sub-centers we need, but now is functioning in the 1,54,404 sub-center one day now functioning in our India. At the same time, the primary health center, we need the 31,333 are required, but we are having now functioning 24,918 primary health centers only is functioning in our India. At the same time, community health centers only 5,183 community health center only functioning, but we are required in 7,820 community health center we need. This is the main infrastructure, lack of the infrastructure. What are the main, next slide please, main demand will be occur means the Indian rural infrastructures has improved since the implementation of the National Rural Health Mission and also the Ayushman Bharat in 2018. However, remain it still ill-equipped to tackle challenges posted by the COVID-19 pandemic. Rural India has historically had less access to health services. At the same time, the sub-center and primary health center as community health center in the rural India often lack diagnostic equipment and also medications. Even though medical reports on the Bihar is reported that the absence of the ambulance in the health centers, facing many patients to walk long distance to assist test kit and also basic medication like paracetamol also. These are all the main infrastructure and also the telecommunication. Next slide please. Lack of the telecommunications, the technology to bring improvement in the current healthcare system and especially in the rural areas, enduring the challenges remind us. However, the such lack of the connectivity and infrastructure of the smartphone, even though the ASHA workers are not having the smartphone, and how they are going to update these statistics in the rural area. We are getting the data from the rural area, the local workers who are working in the local community, mainly the ASHA, the ANMs and the AWW. This persons only they get the information to the central government. So if it is the lack of technology and also lack of the skill in utilizing these smartphones, we cannot update the proper data to the in the central level. And also developing the robots IT system has been one of the objective of the Ayushman Bharat program. Not all ASHA have access to smartphone. That is only I told now. Next, overall rural population still rely on the basic mobile phones being without means to purchase the smartphone. Thereafter, central government efforts such as the health minister's guidelines regarding the teleconsultations with a specialized doctor will likely fail in the rural areas. Well, mainly we are getting all opportunities in this urban area, but we are not getting this opportunities like the telemedicine center. We are not getting in this rural area. Next slide. So next we will see about this human resources. Who are all the human resources? Mainly the doctors, nurses, and health workers who are all working in this ground level. The other persons only here. Human resources. So Indian rural districts suffer from the shortage in qualified medical personnel, and also the system rests on the ASHA who act both the provider and facilitator of the medical care. The India is 1.3 million army of female health activists, mainly the Anganwadi workers, have played a crucial role in the managing the COVID-19 pandemic, conducting the contact tracing and engaging the sensitization campaign among the populations. So now we are having the ASHA workers and also Anganwadi workers, but as not as enough to work in the 1,000 population. Mainly they are ASHA workers who they cover only 1,000 population, but nowadays the ASHA workers is concentrating on more than 2,000 or 3,000 population in rural villages. However, according to the survey, over a quarter of the ASHA have not received either the mask also preventive, that is a PPM also is not getting in the ASHA workers. So this is the main reason. And also next slide. So human resources in the rural primary health centers, according to the rural health statistics, 2019 to 20, 14.1% of the sanctioned posts of the health workers of the female are ANMs, and 37% of the sanctioned post of the health workers in male are currently vacant in the sub-centers. Furthermore, shortage of the doctors, that is in primary health centers across the rural areas, as well as the nursing staffs, mainly the female health workers and pharmacists and laboratory technicians also lack in this pictures. And this source is source from Ministry of Health and Family Welfare. Next slide. So human resources in the rural community health centers. How it is the human centers will be the human resources will functioning in similar situation prevails in this community health centers. Mainly already we saw the rural health center, that is a primary health center. Now we will see about the community health centers, which are designed to provide the specialized medical care, including the surgeries. They are operational with about 24% of the required specialized doctor. The state like Orissa and Chhattisgarh, Rajasthan and Karnataka and Uttar Pradesh face some of the most severe shortage of the doctors and medical officers and nursing staff in this current situation. The source is taken by Ministry of Health and Family Welfare. Next slide. Next our challenge is public investment in this healthcare field. How the grant are sanctioned in this related to the public health, related to the healthcare. The National Health Policy 2017 declaring the government expenditure in the health will reach 2.5% of the GDP by the 2025. The analysts note here winding gap between the required and actual central funding focus the states, that is the Bihar, Rajasthan, Chhattisgarh and Madhya Pradesh, Orissa and Jharkhand and Uttar Pradesh and Uttarakhand, who together account for the around half of the Indian population have the disproportionately lower numbers of the healthcare workers. So next slide. Data collection and dissemination is the next challenge. That is here. Data collection and dissemination is here. Sample registration system and hello. Hello. Ma'am, some disturbance will be there. So data collection and dissemination, that is a next challenge, is given the shortage in this testing capabilities and poor data collection, and also the accurate picture of the spread of COVID-19 in the rural area remain absent due to the sample registration system is not at all update to the central level. At the same time, data also is not undercounted in the villages. Most data are not registered in the rural India, and it is easier to bury the death in the field and open areas. Without reliable data, policies to trap the spread of the virus and the treatment of the affiliated persons will be even more challenging. Updating of the sample registration system is very, very important, but it is back in the rural area. Next slide. Next slide, please. So, next challenge is, that is a food insecurity and economic crisis. The food insecurity, the most of this the COVID time, most of the population is having the lockdown situation. During this lockdown situation, the persons are suffering from this food insecure, lack of the food and money, and also the lack of job. That reasons the persons are persons are begging to this situation will occur in this during COVID-19 situation. So 2021 Union budget says that enhancing allocation of the INR 3,56,000 million for nutrition related program and INR 2,86,000 million allocated for the women related programs. And also the government has also announced the relief package of the INR 1,740 billion under the Pradhan Mantri Garib Kalyan Yojana for the poorest of the people. One nation, one ration card scheme to avail for the food grains under the Nation Food Security Act would benefit migrant workers. This is our government strategies is given, but the people are not at all getting this opportunities also. Next slide. the disproportionate impact on the woman. Next slide. So how the women are affected here? The disproportionate impact on women, mainly more hours spent on the unpaid domestic works. Mainly the farmers are utilizing the more this kind of the migrated people to their own work, but they are not spending the more salary to that, paying the salary to that particular women. And also high risk of the mortality rate will be occur at the same time. More people are getting the pregnancy, and also teenage pregnancy also is very increased during this COVID-19 period. Women account for the more than 70% of agriculture labor forced in this country, in this countries where they are a little pay and social production will be occur at the same time. 9.2% of the teenage pregnancy will be occur in this due to this lack of the education and poverty and the employment opportunities. The most adolescent girls went for the went for the some employment opportunity they get for this teenage pregnancies. And also the rural district, even the maternal mortality rate has declined in the past decades. It remained higher at the 143 per 1 lakh live population. Next slide. The migrant worker. Next we will see about it. Migrant worker. During the nationwide lockdown 2020, many of these migrants failed to find the informal job, and that sustained them in the cities and had little choices but to undertake the odious journey back to their village. At the same time, February and March 2021, the threat is that virus muted further. The migrant would not be carried on the deadlier variant in this both rural and urban areas. So they are carrying these viruses through this urban to rural. The rural community were spreaded fully through this migrant people only. Next. Then once the person is getting this COVID-19, the societal attitude, how it will be occur means the stigma associated with the COVID-19 based on the three main factors. Mainly the disease is a new, that is new disease. At the same time, which there are still remain unknown. At the same time, we are often afraid of the unknown cause. At the same time, it is easy to associate with the fear and others. And the impact of the stigma can, how it will be make the people to in the society must drive people or hide their symptoms. At the same time, avoid testing and avoid discriminations. So there are people having the symptoms also, they are not going for the testing, and they are in this houses itself. So they are the time the easily the disease is spreading to the family members. The family members are, once they are going to outside means they are spreading in this community area. At the same time, they prevent the people from the seeking healthcare immediately. Once they are suffering means they are not going for the treatment also nearby in the health centers. At the same time, discourage them for adopting healthy behaviors. Once we are telling SMS, mainly sanitizing, hand washing, and next one, this social distancing, this and all they are maintaining in this family itself, or they are spreading the disease to others. They are not maintaining the healthy behavior in this family itself. The lack of the information related to the vaccination as well as and in the unknown to hear of the rural village residing the government vaccination drive. So they are, if the already I told, if the persons are giving the village health nurse or otherwise the ASHA workers, they are going to the doorstep to the vaccinate also, they are not getting to the vaccine. Okay, these are all the main social attitudes of the during COVID-19 period. This is also one of the challenge. Next, how we have to go through on it. So what is the main aim of this rural community response during the COVID-19? Yes, to reduce the risk of the COVID-19 in community spread. So we have to reduce, to avoid, what are the preventive measures we have to follow, that and all we have to focus on this to reduce the COVID-19 community spread. At the same time, to improve the general health of the population and which may minimize the severity of the COVID-19. Okay, these are all the main aim to rural community response during the COVID-19. Next slide, please. So this is the actions and initiatives in 4 main broad areas we have to look after them. So first step is the health response and improving access to the medical access. So how we have to assess this means access to medical equipment in remote places in more limited than in the cities. So there are 4 places is there. The action and initiation is a broad 4 areas is there. So first one is the health response and improving the access to the medical services. Second one is the maintaining basic health services in the rural area, supporting the rural business and workers, and also fourth one is the improving the digital infrastructure and the digital accessibility in the rural area. So how we have to focus on this? First, we'll see about the health responses and improving the access to medical services. So how we have to assess mainly the medical equipments in the remote places is more limited than in the cities. Many trend to be longer delivery time due to the greater distance from the economic centers and insufficient development in infrastructure, and also initiation of the ranges from making the health services more accessible in the remote places and delivering the medical equipments, bringing rural people closer to the health services. At the same time, joint response between the national, region, local level to the COVID-19 have been essential to improve the provision of services for the rural area. At the same time, initiatives to deliver the make available medical equipments. Donation, mainly the private sectors are donating the medical equipments to the rural public health centers, mainly the donation of medical equipment such as the mask and respirator to a large number of the hospitals to supply need of the local hospitals throughout the India. So these are all the way we have to responding the improving the access to the medical services, and also mainly the community response have also initiated bottom of the initiation the vulnerable rural community, aiming to make the medical equipment available. And some private companies also is donating the small pulse oximeters to the rural community centers. These are all the way we have to we have to improving the access to the medical services. Next one we will see about the maintaining the basic services in the rural area. At the same time, this improving the access to the medical services, mainly the mobilizing the local network of the healthcare workers and voluntary programs have emerged to help the rural community face the efforts of the COVID-19, mainly the telephonic counseling and home medication delivery and provide the medical advice. These are all the way we have to give. At the same time, digital solution also created to disseminate the information to pandemic and help the self-assessment. We have to improve through the way Arogya Setu app developed by the National Informatics Center under the Ministry of Electronic and Information Technology. It is a mainly public-private collaboration record the time and the fight of the COVID coronavirus. These are all the way we have to improve the response and improving the health response and improving the access to medical services. Next one is the we are maintenance. How maintaining the basic services in the rural area. How we have to maintain the rural basics rural area means mainly basic services we have to provide. What are all the services is available in this primary health center or sub center? We have to through the healthcare workers we have to inform to the disseminate utilize the what are the services is available in the primary health center. We have to tell to the rural public people they have to utilize this basic services, mainly the securing food availability and assisting the elderly, and also all Indian government provided offering free grocery delivery to all ration card holders, and also many voluntaries are provided food for the elderly and poor, and also COVID positive cases they are providing the food in this houses itself in the urban area. Same like this, the rural area also some of the voluntary NGOs are providing the food package to the poor one. Many same time communities supporting the local economy by strengthening the local food supply chain. These are all the way we have to initiating to maintain the basic health services in the rural area. Next one we'll see about the supporting for the rural business and rural business. In this, India is ensuring the access to credit for farmers and providing the new initiatives for the tribal groups. At the same time, we have to providing the services to the that persons who are in the urban side. They are starting the big business in the rural area. That time only we have to improve the rural community. Next one is the improving the digital infrastructure and the digital accessibility in the rural area. mainly the implementation of the broadband of funds to support the universal access to internet and enhancing the distance learning and healthcare e-services and quality education platform through the dedicated education time slots on the radio and TVs, and also ensure the online education infrastructure and nationwide schools, and also more efficient government and adaptation of the e-government in this platforms. These are all the way we are improving the digital infrastructure and digital accessibility in the rural areas. Next slide, Paul. Next slide. So relevant messages to leverage some of the opportunities include what are the opportunities will have the how in this COVID-19 period, speed up the investment in the digital infrastructure and remote services. We have to concentrating on the national rules to the specified of the rural communities, training of the teachers and healthcare professionals to adopt the remote forms of the service delivery, and also financial and technical assistance to support the community-based and social innovation projects, and also main at protecting the most vulnerable citizens in the rural areas, including the elderly and the migrant peoples, and also sustainable criteria in COVID-19 is recovery action so that they are also contribute long-term residents by addressing the climate change and the economic ecological transition. The last one is to support the resilience of the rural community, enhancing the social network and living standards of the vulnerable citizen in the rural area. These are all the measures we have to take this through this opportunity space. We are control this. We are challenging this community. Next slide. So what are the opportunities will be there to emerging the crisis situation? So emergency crisis situation, mainly already we saw that higher relevance to enhance the quality and use of the digital tools and dashboard broadboard in the rural regions, and a remote disturbed working might increase the linkages between the rural and urban, and a shift in the consuming habits can favor local product and destinations, and greater awareness to enhance the accessibility to quality services, mainly the e-health and e-education, reshorting of their strategic, including the industries that were once delocalized, that is the raw materials we have to producing more, and at the same time low carbon in economic and for the communities, the mobilize and strengthen the local network and the cooperative structures to face the future shocks. These are all the main opportunity emerging in this crisis situation. Next. So what are the how we have to responding the rural community, how rural community is responding in this COVID-19, that we will see now. So many approaches we have to see in this approaches for the public health profession. We have to review the data and resources, mainly the review the data and resources to better understand the burden of the disease in our community and state. Network collaboration with the healthcare providers, mainly the others, for example, healthcare workers, educators, counselors, and business and advocacy and community labors and faith-based organizations, and that we have to collaborate with doing our services. At the same time, identify the pattern, needs, and way to assess the resources such as the personal protective equipment and medicines, mainly the and other necessary items, and all we have to see identify the partners who have they are delivering in this donating to in our community area. Next, work with the advocacy and community labor and faith-based organization to better understanding the community knowledge, needs, and barrier and challenges around the COVID-19 prevention, and improves the community leader to save racial and ethnic minority population, people with disabilities. This is the main first approaches. Next slide. Next slide. Second one is we have to the approaches for the rural healthcare system and the healthcare provider. Mainly the planning, how we have to planning the health. So that is they develop a COVID-19 action plan with the staff and make adjustment to fees, and also serve that as a served and mainly produce the procedure based on the patient's populations. You have to served mainly the older adult and the chronic illness and people with the disability and who is having the substance use disorders in children. These are all the persons that comes under the develop a COVID plan. And next, at the same time, identify plan for the transporting people with the COVID-19, including those with a disability, the care at the other healthcare system, and provide if your hospital are in the slow suffering, decrease the services. We have the guide the client to take the persons in the easily transporting arrangement. We have to choose. At the same time, maximize the existing personal productive equipments to prevent the shortage, and partner with the state and local health department, hospitals, and other healthcare system, including the metropolitan areas, mainly that get regular information about the local infections rate and develop the contact tracing plan, and also offering the telehealth services to reduce the risk of the infection in the clinical setting. The next we'll see about the patient, how it will be working in this patient care. Call the clinician on the call centers, mainly 24 hours hotline with me, trying the CDC clinic, standing by the answer to their queries, and also explain the patients with high risk severe illness for the COVID-19 and also the COVID-19 patients informed and safe and empowered. At the same time, how to learn the reimbursement of the providing the COVID-19 testing treatment, and also the recovery and rehabilitations, and find ways to ensure the COVID-19 testing needs of the meet the working states and their department and commercial laboratories. Next slide, please. So approaches for the community. These are approaches for the business and workplaces. Mainly in this rural, use the strategies to help to prevent the spread of the COVID-19 in this workplace. We have to encourage the employees to provide the PPM, and we have to give the stipend of this particular client. They're suffering the COVID-19, the particular client. Provide the supply for the cleaning and disinfecting workplace and appropriate personal productive equipments. We have to provide the particular employees. That's a consideration for the outdoor mask user. If you are not ill, vaccinated, not fully vaccinated, and age below 2 or older, you should wear a mask in indoor public places. And also in general, you do not need to wear a mask in outdoor settings. This is the mask consideration to use, how we have to use. These are all the approaches only we have to use for the to responding the community in COVID-19. Next slide, please. Next slide, please. So what are the recommendations for rapid COVID response to the community pandemic? So what are the response? First, we have to constitute a task force. That means we have to, that is a constitute task force means what? It is a, the government of India should immediately form a task force with a member from the Ministry of Health and Rural Development and Agriculture, Panchayat Raj, and a state government, along with the experts in the health and other areas like a sociologist and economist. This task should be posed on 2 components, meaning this for enforcing the COVID-19 protocol and improving the rural health infrastructure. Through the way we have to focus on the rural area. Next, we launch a massive communication drive and guiding the public. How there we have to raise the awareness. Mainly the awareness, raising the awareness through the massive public outreach campaign should be among the Indian first step in fighting against the COVID-19 in the rural area. India has conducted a successful public information campaign for the health issues like polio, HIV, and also leprosy. A similar way, we have to start the campaign for the to launch. We launch this to use this media, mainly the television, radio, and newspapers, and door-to-door campaign by the health workers. These are all the way we have to give the information to the rural public. Next one is the strengthen the rural health system. Mainly the how we have to strengthening means health policy experts and advocate have long been demanding increasing the budgetary allocation for the strong and comprehensive primary health center, primary health care. Mainly the improvement of the primary health center and community health center, and also the COVID-19 pandemic also exposed the Indian vulnerability to health shocks and demonstrate the need of the increase the investment in the health sectors. So these so we have to give the strengthen the primary health center and the sub centers and provide a special economic package for the rural India. Maybe the center should announce the special rural package to help the states over current situations. Maybe it will be mainly focus on the ensuring the food and livelihood security for the families. The public distribution system must be strengthened to ensure the accessibility and availability of the food grains, and also they have to the rural public may use for the MGNRE Act, that is here Mahatma Gandhi Rural Employment Grant Act. Next, ramp of the testing and vaccination. So to gain the closer picture of the infection rates, so last year target response, more rapid response terms will be displayed in this. Mainly we have the door-to-door visit should where the health workers check temperature and the oxygen saturation and also level saturation level and also other symptoms. The mainly only 13 in this crisis situations, only 13% of the rural population only they got the vaccination. So the testing units can be camped at the local bus stop and also especially where the closest and heavy and also we have to mainly we are putting the testing campaign and also vaccination campaign in this bus stop and the other general public places. So next one is the organizing relief at the village level. In this village level, mainly the campaigns we have to start to do for the health camps, and also we have to provide basic medicines to the public and rural public to this in this rural level itself, in this village itself, and provide how we have to recognize the village society means who are all the working in this panchayat level. We have to that the effort also we have to give to recognize they are doing the some help to the rural public. We have to recognize the civil society for their work. And also next slide. So provision towards the special economic package for the rural India. This is Tamil Nadu package. They are giving the 14 items in this grocery items and 2,000 rupees they are giving for each ration card holders. And also in our nursing students are distributed during the COVID-19 situation. They are distributed the food package to the rural peoples and also the poor. Next slide. Please, next slide. Same time, the ramp up the testing and the vaccination center in the public place. This is also in our students only. They are doing the community services during the COVID-19 situation in our community health centers as well as in this corporation hospitals. Next slide. So, fill the vacant health care positions and recruit the more staff. This is also one of the recommendation. Once the human resources will be increased, means we have to reduce the mortality rate. The primary health ANM and Asha workers and family health workers, female health workers and male health workers and all, we are improving. We are recruiting more men. That time we have to reduce the human resource insufficiency. At the same time, impose the strict rules of gathering. So gatherings we have to reduce. So marriages and all nowadays the 50% only attending. Even the death also they are attending only 50 members only are, and below 20 members only they are attending the death cremations and all. So we have to strictly avoid the gathering of the public. That time only we have to reduce the spreading of the disease to the others. And distribution of the essential medication and equipments. We need the urgent need to mobilize the resources for the distribution of the implement like thermometer and pulse oximeter to the families, and the follow-up should be conducted by the community health workers. The Panchayat Raj and village health and the nutrition committee can be involved in this task. How the home medicine kit can be provided to affect the household all the way we have to distribute the essential medications and the equipments. Then create a gender sensitized response. Mainly mainly the woman only frontline workers of in our society. The woman frontline workers should be vaccinated and urgent basis. The stipend of the ASHA workers must be increased. There should be a special guidelines for the more vulnerable groups. For example, pregnant women. Mainly they are not receiving the proper medications during this the pregnancy period. At the same time, we have to focusing on the non-COVID medical needs also, and also including the birth. These are all the way we have to create the gender sensitive response. Then finally, they encourage the private sectors to invest in the rural health. So business, we are improving means we have to reduce the poverty and pollution. If the businesses are more in this rural area means the rural people get the more job opportunity, and also they are going to next level of the economics. So that the time we have to reduce the poverty. So ensure the people can avoid these benefits of the public welfare, mainly the schemes that is NGREA, mainly the National Rural Employee Grant Act and a public distribution system, direct benefit transfer, and a Pradhan Mantri Jan Dhan Yojana and, and others. Encourage the private sectors to invest the rural health. These are all the way we have to give the recommendation to respond the rural community in this, during the COVID-19 period. Next slide. Next slide, please. So, who are all the frontline workers? In the rural, local village, the human resources in our ASHA, primary health nurse, and the community health nurse. These are all the populations only frontline workers. How they have to prevent and management of the COVID-19 virus. That is, we will see now. So, next slide, please. Next slide, please. So role as a frontline worker in the rural community, there are two ways. One is spread the key messages in the community about the message to prevent the infection and take action for the yearly detection and referral of the suspected COVID-19 cases. This is the two way we are following the actions to the community rural areas. Next slide. So role in the yearly detection referral, how they are doing means the community workers prepare a list of the all people who are traveled or other countries, other states inside the India within the 14 days, and share the information with the medical officer of the PHC, but not with others. And also ease them about the home quarantine for the next 14 days and monitor themselves for the symptoms of COVID-19 and inform to the symptoms to develop the COVID-19 helpline. These are all the way we have to do the yearly reduction and referral to the public, rural community to in the centers, primary health centers. Next slide. Then how we have to performing the frontline workers during the regular duties in the frontline workers. Take all the preventive measures in the community, such as the keeping safe, that is a safe distance, and wash hands and frequently before and after the home visit. If visiting the accompanying sectors, mainly the suspected cases to any facilities, make sure to wear mask and recommended the PPE. Maintaining safe distance from those living in the crowded areas or homeless will be difficult. Each and mainly they inform about the COVID measures, preventive measures to support the required. These are all the way we have to give the regular duty we have to follow in the frontline workers. Next slide. Then self-monitoring, ensure the self-monitoring, and also they ensure the perform the regular tasks, and also reassure the cases who are having the symptoms in this close attention to this in this rural area. We have to refer to that to the particular main hospitals, and also we have to regular task the pregnant women and newborn and sick children, and also postnatal mothers, and breastfeeding and nutrition counseling, mainly the communicable diseases and the NCDs, and also we have to follow up in preventive measures. We have to follow the particular these kind of the patients also, clients also. Next slide. This is the going to last we are going the last slide. Now, so rural, what is the main role of the ANM and the ASHA and the AWO? The COVID information we have to prevent and we give the information to the rural public, preventive and control measures, including the social distancing during the space of COVID outbreak, and advising the myths and misconceptions, mainly in the stigma of the COVID-19 and contact tracing of the all the people who are having the symptoms and who are came for the from the urban to rural, that tracing and all we have to inform to the ANMs should be informed to that medical officers and also link with the public health, mainly the public health link we have to share to the public, and also they have to contact to the in this other community centers and district hospitals, and also psychological care and discrimination, stigma and discrimination. This and all we have to focusing on that. Reporting and feedback is very essential to these ASHA workers, and personal safety and preventive measures of the COVID-19 we have to spread to the rural community, and supervision and the effective use of the COVID-19 through this IUC materials. We have to disseminate the IUC material through the messages. We have to disseminate the message to the public. These are all the main rules and responsibility of the ANM, ASHA, and the Anganwadi workers. Next slide. So measures to control the spreading of the COVID-19. Already we know social SMS, and also we have to maintaining the social distance, and we have to wash the hands before and after wherever we are going and come to the home. Then we have to avoid the crowd places. Once we are masking. Once we are getting the mask, only the mask we are wearing in the once we are going to the outside, just wear the mask. These are all the measures we follow for the spreading. We control the spreading of the COVID-19. Next slide. So be kind during the COVID-19. So be kind to address fear, and be kind to address stigma, and be kind to support loved one. This is the home take message to this session. And I finalize this, summarize this, my presentation through this. I wind up this, my presentation. So through this, what is the main conclusion is, as a COVID-19 pandemic in rural communities, the need for closing the rural and urban health gap is more critical than they ever. The differences in the health status and socioeconomic vulnerability, health access, and care-seeking behavior are deeply rooted and to save. So let's be a part of the fight against the COVID-19 by supporting the healthcare personnel and control the spreading of disease in the rural village. Together we can, and we will beat the COVID-19. Thank you. The references is given here. So I referred to so many journals and also so many Health and Ministry of survey. So through this reference only I got this presentation. Thank you, ma'am. So be safe from the COVID infection. Be smart in inform yourself about it, and be kind and support one another. So our theme is we are preparedness to the conception to old age. So all together we will fight the COVID-19 and we will be safer. Thank you.
Thank you so much, ma'am, for enriching us with how swiftly we can, as a community, respond to COVID-19. COVID-19 has, from its first wave and second wave, has affected a lot of people and also posed quite a lot of challenges for the nation, especially in rural areas. Also, as stated by ma'am, we are thankful to our government for the strategies that has been implemented, and also the for the betterment of the society. And also, Bev has well explained how, as a frontline worker and as a healthcare worker, can contribute to the health and well-being of the young people. Thank you so much, ma'am. So for now, I would like to ask the participants if there's any questions, and you can drop it in the chat box.
Hello.
Yes, ma'am.
Can I leave? Understand my presentation? It's useful
Yes,
for
ma'am.
all audience. So last two sessions is very we are seeing in this hospital setting. While coming to the community area, we are focusing on the human resources like for the then community health workers only no. So we are concentrating on mainly in the that local people who are working together in this community. So our students also is more interested to work in this community area. They are giving the services in more even testing, COVID testing, even though in this vaccination drive, everywhere they are looked in our final year students.
As there are no queries in the chat box, I believe everyone has been enriched with the knowledge that ma'am has provided. Thank you so much, ma'am.
Okay, okay. Thank you.
On to the valedictory session. First, we have the feedback from the participants. Therefore, now the session is open for the participants to share your experience and give your valuable feedback in this 2-day virtual CNE program that we conducted. Anybody from the participants can share.
Julan, hello.
Yes, ma'am.
If there is no feedback from the participants, please carry forward the session.
Okay, ma'am.
Yes, ma'am. Thank you so much. Thank you so much, ma'am. Yeah, you can proceed,
Yes.
ma'am. Thank you. Thank you so
Okay,
much.
okay. Okay, thank you, ma'am.
All right, then moving on to the next. Moving on to the next, we have the vote of thanks. So, first of all, I on behalf First of all, I, on behalf of Faculty of Nursing, Assam Downtown University, would like to thank Almighty God for His grace and ever presence. I would also like to convey my gratitude to our very own Dr. NN, the Honorable Chancellor Sir, Assam Downtown University, Dr. NC Dalukdar, Honorable Vice Chancellor Sir, and Professor Mrs. Vandana Datta, Dean of Studies Madam, and to all the members of Board of Trustees, deans and directors of different faculty of studies, to the advisory boards, chairperson, Professor Mrs. Maxi Senta, and co-chairperson, Professor Mrs. Animali Gogoi, Madam, and organizing secretary, Madam Ruth and Madam Monica, and to each and every committee members for their consent, support, and timely advices throughout the program. Not forgetting the IT department, who has been our savior in all technical related matters and issues. I would also like to thank our speakers for the course. Mention in particular, I would like to thank Madam Barutatta, Dr. Lee Poda Madam, Dr. Sai Lakshmi Kanti Madam, Madam Madhuri Kawas, Dr. Bhuvaneshwari Ji Madam, and not forgetting Professor Mrs. Mansi Gupta Madam for taking the pain and putting your tireless effort in presenting to us the best possible you could to enrich us with such an overwhelming knowledge besides your busy schedule. Thank you so much. Last but not the least, I extend my sincere gratitude to all the esteemed participants present here for joining us, giving your valuable time and attention for your kind cooperation. We value you and we really appreciate that you have joined us to contribute to the success of the event. I believe that we all are a positive image to what tomorrow may look like. Let us ourselves with the knowledge we have learned here in this 2-day virtual VCNE program, and let our action be a statement to send a positive statement in times like these. The future that we are all looking forward, that is a happy, healthy world, and getting back to doing more of the things that we love and enjoy with the people. All this can only become reality if we work the right way. With this, I would like to end with the word of thanks. Thank you. Now moving forward with the next event, we have concluding remarks. Therefore, I would like to, for the concluding remarks, I would like to request, we have Dr. V.C. Sharma sir, and we have Dr. Brigade sir, and Professor Mrs. Nimali Gogoi madam for the concluding remarks. Therefore, I request you all to kindly take your turns to say the concluding remarks.
Sir, unmute করিল Sir, unmute করিল
Sir, it's muted. Oh, yes, sir.
Good afternoon to you all. At the very outset, I must congratulate the Faculty of Nursing, especially Mansi Sengupta, Dean Faculty of Nursing, for arranging such a time-needed CNE on a topic, preparedness and management of COVID-19 from conception to old age. In these 2 days, we had thorough discussions and we learned from the learned resource persons about the various aspects of COVID-19 and also had interactions and discussions on the topic. It is very difficult to cover the whole topic in these 2 days, and I have observed that the resource persons have done a elaborate study on the subject, and they have covered all the important aspects of COVID-19, and from the management, starting from basic nursing care to the critical care, rural community response, public health awareness. Now they have also depicted nicely what are the problems in managing the second wave of COVID-19, what may be the problem sequences, and they have even given some recommendation to the government as well as to the general public or as a whole to the society to how to prevent this COVID-19 or how we can get rid of this COVID-19. Now again on this day, we are expecting that there may be or we may get another wave or third wave of COVID-19, which may affect the children and the newborn. So in this CNE itself, one of the learned research persons have nicely and elaborately explained how to tackle this third wave if it comes at all, and how we can manage the maternal, newborn, and the children from the third wave of coronavirus. I am confident that all the participants of CNE, this CNE have been benefited from the exquisite scientific sessions as I have myself. I like to pay my deep respect to all participants who have joined in the CNA with a positive mind. I hope that these participants have learned a lot about the COVID-19 and which will help them in future in their academic as well as in their day-to-day practice. So I would like to conclude my address by congratulating the honorable learned resource persons, organizers, and the participants of the CNE and making the CNE a great success. Thank you all. Over to Dr. BKD.
Right. Thank you, sir. Thank you so much. Well, at the very outset, I would like to congratulate the entire organizing team of Faculty of Nursing for organizing such a pertinent and fit, event at this present moment, when we actually are still deep into the chaos and the situations in and around that has been created by COVID-19. We actually could not really find an answer to all those. I was going through the various topic that has been selected and talked by various resource persons from different parts of India. The topics were so well blended that all the aspects, almost all the aspects in terms of preparedness and management of COVID-19 has been talked about, has been discussed about in detail. So I'm sure all the participants, be it the faculty members, be it a student, everyone has got a leave from this, and definitely they are going to be benefited in terms of their practical exposure. The moment they are going to drive into the field, they are definitely be benefited with the sort of the discussion that has happened till yesterday. So I'm really glad that that the Faculty of Nursing has taken up this event to organize in a situation when actually it is needed. And I personally believe, being a pharmaceutical being with the pharmaceutical background, pharmaceutical science background, I personally believe that the nursing people are actually the bridge in between, the integral bridge in between the patient and the entire medical and paramedical, in between the patient and the medical and paramedical staff. And that is how it's really very much important that all the nursing faculty, nursing students, as and when they are interacting, they are onto the field, they are onto action, then definitely they are equipped with certain level of knowledge, certain level of expertise while handling the patients. So, so this particular event under CNE with the theme of preparedness and management of COVID-19 has certainly added value to all those concepts that are required before going into the actual practice. So with this, I once again congratulate the organizing team, all the participants for participating in a huge number, which is really encouraging. And of course, all the resource persons who took out time from their busy schedule to discuss and share their knowledge and experiences with the participants. So once again, thank you so much for organizing such an event. Thank you. Over to Jilan, our moderator today. You and other moderators also has done a fabulous job.
Hello, Zulon. Is it the closing remark now? Hello, Zulon.
Yes, ma'am.
Is it the time of closing remark now? Okay.
Yes, ma'am.
Okay. Okay. Thank you, Zulon, for giving me the opportunity for closing remark of the program. Very good afternoon, all dignitaries. Finally, on behalf of Faculty of Nursing, Assam Downtown University, I, Professor Nirmali Gogoi, would like to express my appreciation to all the participants for taking time off your busy duties to attend the 2 days program, and also your organization for sending excellent participants. We are so glad to announce that we have 382 numbers of participants from all over the country. Half of the participants attending in another portal. Because in the Zoom it is showing the almost half of the participant. I believe that all of you have benefited from this program because the program aims to enhancing the academic and intellectual environment in the institution by providing faculty members with enough opportunity to pursue research and also participate in seminars, conference, and workshops. Participation in such program would enable faculty members to update their research and pedagogical skills. Every year, we, Faculty of Nursing, Assam Downtown University, organize CNE Faculty Development Program, national or international conference as a part of academic curriculum. This time, we selected the topic which is very time relevant, that is on connection of present scenario of pandemic. We all have seen how devastating the world now. But anyway, we have to face the challenges, we have to fight with them, we have to prevent them, and we have to manage them. For that, we need to be prepared. We need knowledge, encourage, and dedication. For these purposes, we try to cover as much as by the eminent resource persons from all over the country. Very renowned person, Madam Parul Dutta, retired principals, Nursing College, West Bengal, elaborately explained a very important topic on preparedness and management of children against third wave of COVID-19 pandemic. We all aware that the impact of third wave of COVID-19 is predicted basically on children. Already there is a huge loss in children life in all aspects of health. Child life reflects the country's life. So we have, our prime responsibility to protect the children from crisis situation. Dr. Lily Padar, Associate Professor, Nursing College, AIMS, Bhopal, have covered very extensively the topic on recent challenges and management of maternal and newborn care during COVID-19, which is very important for preventing and healing the problem of COVID-19. Dr. Chailakshmi Gandhi, Madam, Professor and Head of the Nuhans, Bangalore, very wonderfully delivered the topic on supporting immune system and mental health during COVID-19. Madam Madhuri Gawas, Assistant Nursing Superintendent, Shaifi Hospital, Mumbai, Maharashtra, where Madam has effectively presented very important and practical best aspect on managing ICU surge during COVID-19 crisis rapid guidelines. Dr. G. Bhuvaneshwari, Associate Professor, Sabita College of Nursing, Simant Thadalam, Chennai, have delivered a very interesting topic on swift direction of rural community response to COVID-19. It is a very sensitive aspect of the current pandemic situation. Inclination or declination of the COVID curve is depend on the rapid rural community responses. All the speakers have covered excellently about the preparedness and management of COVID-19 in different categories of clients from antenatal period to the old age. Because severity impact of the COVID-19 is different to different categories of the patient. Example, management of the mother during antenatal period in COVID-19 is different from management of a children or a management of an older adult. I believe all participants must fulfill your objectives from the excellent deliberation of all the eminent intellectual resource persons. At last, on behalf of Faculty of Nursing, Assam Downtown University, my heartfelt thanks goes to all respected resource persons, all delegates, organizing committee, authority of the university, and technical persons for their outstanding support for the successful today's faculty development program. Now, I would like to close my remarks and officially announce the end of the session of the faculty development program. Wishing you all future prosperity. Thank you very much. Thank you everyone once again.
Thank you.
Thank you so much.
Thank you so much, sir, and thank you so much, ma'am, for enriching us and taking time for the concluding remarks. We now have come to the end of our two-day virtual CNE program. Thank you all for joining us, and we look forward to meeting you all in such virtual events, and not just in virtual events, but we would also like to meet you physically. Once the situation and the things get normal, then we can gather together and we can share moments like these in near futures. Therefore, we wish you a happy, blessed, and safe stay. Thank you all.